Hello and welcome everyone to today's digital health event hosted by Vator Securities. My name is David Myslinski and I will be your moderator. This event is one of several events that are tech-focused and hosted by Vator Securities. In March, we had Software as a Service, and we're following up with Gaming in May and Tech of Tomorrow in June. So stay tuned and watch your inbox for the invitations. So, for those of you not familiar with Vator Securities, let me give you a brief introduction. We are a boutique investment bank out of Stockholm, Sweden, and we work with Nordic life science and tech companies, or basically growth companies. In 2020, we did some 15 transactions, raising in excess of 150 million euros, and we work with both private and public companies. In 2021, we aim to increase both the number of transactions and the amount raised significantly. Worth mentioning that we work with smaller transactions ranging from 2 million euros up to the really big ones of 40 million euros. So, why are we here today? Digital health is growing, and where is the growth, there are investment opportunities. Digital health could be anything from a mobile medical app and software supporting a doctor's day-to-day decisions to artificial intelligence and machine learning. There are several benefits with digital health. We can reduce inefficiencies and cost with the help of technical platforms. We can improve access to care through telemedicine and telehealth. We can increase the quality through digital diagnostic tools, and we can make medicine more personalized for each patient. According to Gartner, over 60% of healthcare providers have already experienced severe disruptive changes due to the digitalization of healthcare. Changes come in the shape of cost pressure, organizational changes, and shifting customer demand and expectations. So most of all, if not all caregivers at one point or another will have to adopt a digital health first perspective. Pretty similar to when the smartphones entered the market and a mobile first perspective was crucial. So also according to Gartner, there are several trends that support the growth of digital health. The actionability of big data. The more we can do with big data, the better we can handle it, the more educated decisions we can make. Adoption of predictive analytics, that goes hand in hand with the first trend. Increasing healthcare cost on the back of an aging population in the Western Hemisphere. And also patient-centered care as opposed to caregiver-centered care. Today, we will listen to the presentations of 7 companies. We will dig into their exceptional growth in 2020 and also the growth in 2021 and beyond. Many of these companies have already established themselves outside of Sweden, their home market, and several are looking to expand further. We will dig into the conditions for that. What does the competition really look like? Also, given the strong track record in other segments of Swedish companies with digital business model, like let's say fintech or gaming, I believe there is strong evidence to support the success of many of these Swedish companies within digital health, and I mean success on an international level. With that said, I would like to welcome on stage the first speaker, Martin Lindman, CEO of Doktor.se. Go ahead.
Thank you, and pleasure to be here and talk a little bit where we are. I'm not going to talk too much about the past, but trying to look quickly into the future and where we're heading. But before doing that, I think it's important to understand the development of the last year happened for Doktor.se and for the market in general. Change slide, please. We're a company that founded and launched in 2018. Can you change the slide, please? Thank you. We were founded and we launched 2018 with a rapid growth, a company that sprung from physical care, knowing how to deliver primary care in Sweden since over a decade back, and knowing that this transformation that we're seeing now and that we're going through as the analog healthcare changing and transforming into more digital is, from our point of view, all in the hands of the individual. A B2C solution, knowing your customer, knowing your patient, that's what's going to transform this market. So starting with Doktor.se is a solution that enable the opportunity for the patient to log on to our service, get a quick introduction to whatever errand that individual need, getting pinpointed very quick to the right care level. With this, we created a very powerful omni-channel for the individual that we are catering to the person's need 24 hours a day, 365 days a year, and we answer within a couple of minutes. With that, we also knew that that position, the portal position that we talk about, that is going to enable us to create a system that caters for the individual, no matter what, whether that is a digital consultation or that needs to be a physical errand. Because one thing that is clear with healthcare that changed a little bit from what we see from the change that transformed with retail or the financial sector is that at the end of the day, we'll still need the physical care, and the physical appointments needs to be there, and is also catered to the underlying consultants, the doctors, psychologists, and nurses that still need in the future going to be able to provide healthcare. Change slide, please. We are a company that landed into clear three verticals, P&Ls. That one of them are the digital consultations that we've done really well, and we launched a little bit later than a couple of our peers in the market, but scaled really quick. And then from day one, we start talking about the integrated physical solution. All the way back when, as a tech company, it wasn't really looked upon as the coolest thing to say, to talk about physical care, but we stuck to what our beliefs was, that at the end of the day, this will be a 100% integrated model, and that's what we see in the market today. So our physical care combined with the digital solution, that's what creates the most powerful effect for the healthcare system. The third leg to stand on for Doktor.se started a little bit year and a half back when we launched our first platform cooperation with AsthmaTuner. AsthmaTuner then is a veterinarian company that exists in 7 European countries, owned by Mars family, which is the world's largest healthcare veterinarian company. And together with them, we now launched 3 countries. We're going to do their 4th and 5th countries in this year. We package our company and organization, so we're also going to be able to deliver on the platform agreements that we now are signing. We launched in Brazil last year in June with a company called Vibe. They are now market leaders in Brazil, downloaded about over 1 million apps, doing about 40,000 consultations per month. Acquisition cost in Brazil right now for a patient is 10 cents. It gives an idea how quick they are running in Brazil. Together with Vibe, we're now launching another more integrated physical solution in Brazil with a company called Door. They're the largest physical caregiver in Brazil with over 1,000 clinics and 55 hospitals. And we're now about to launch the integrated physical platform that's going to be launched in the next couple of weeks here, which is exciting. These platform corporations going to keep developing. We're on our way into Africa, China, Canada, Middle East, and we're also signed a big contract in Europe that's going to be announced in the next couple of weeks, which is also very exciting. So this leg for us that was a little bit opportunistic driven. Once we started with AsthmaTuner, is now sprung to becoming a very clear part of our organization and how we're scaling our business. Change, please. Looking at the last year and since 2018, it's been a very rapid growth. We're up to 1 million registered users. We've done over 1 million digital consultations. Things are going really, really quick in that launched, and being that aggressive in the beginning was key for us, knowing that we needed to come to the solution or the position into the market where we had that recognized brand name into the market, that we can convert these individuals into more users when it comes both digital and physical. Change slide, please. With that said, even back from 2018, when things were going really quick, everything then obviously went into a much higher pace once the pandemic hit. We saw tremendous growth across the market in all different areas when it comes to digital healthcare, but saying that it's still a very early stage even for Sweden, and Sweden is one of the European countries that this is something that exists for quite a few years now. Around Europe, this is an early stage. We see a lot of these countries developing in the last year once it came to the digital solutions, and really that the rules and regulations change up to the possibility to be a digital healthcare provider. And that's also something that we're going to talk about a little later in this presentation on what we're going to do. But we see this as an early stage, but it's a very interesting and aggressive growth into the market in general terms. Change slide, please. This is the overview of what happened in 2020. We registered another 520,000 patients. So very big growth on that side for Doktor.se. We now have, I see on this slide, it says 120,000 listed patients. We're up to 130,000 right now. We do grow on the physical side quite quick. We launched 3 new countries last year, and we did and combined with our physical and digital, we did 1.2 million clinical consultations. We do have in Sweden 10 physical clinics. Out of we required 6 of them last year. Change slide, please. I talked a little bit about the portal position and how important it was for us when we went through this transformation, and knowing that the market now is going to go from more analog to digital, and what that meant to us. For us, it meant that having the relationship and knowing the individual, the end user, B2C solution, that was important. And it was just important, not that we thought that the end game would be a video consultation or a consultation through an app or a web solution. It was more of having that relationship with the end user, meaning that we then can start converting and following that individual and that patient through a whole journey, healthcare journey. And that starts with a digital telemedicine solution, but it grows very quick. And we see that in 2020, what we've done we're one of the biggest, and in Stockholm, we're the biggest provider of COVID-19 tests. We do multiple testing even outside COVID-19. We see the integrated digiphysical care that we've done really well. We're starting our chronic programs. We're going into prevention care, mental health solutions that we're creating right now. There's a lot of things that we can transform once we have the trust and the relationship with the patient. And that's really the way we see these things, that Doktor.se as a brand name is an omni-channel into whatever care that individual might need at the end of the day. And due to our background, we feel comfortable, whether that is primary care or special care. We are fairly broad in the sense of that we look upon that individual and having different cares at different times in their lives. Change slide, please. We're going to keep doing. We're going to keep integrating our verticals in what we do, and whether one of the biggest ones right now for us, and that we did in the past year, was the integration between our physical care and our digital care. They're so integrated right now that for the individual, it shouldn't really matter whether you seek through the normal analog way into the clinics, or if you search through the app or the web solution and then ending up in the physical appointment. We'll care for that individual no matter what. And we'll take in that medical decision, helping the patient and steering the patient to the right care level. But we do a bunch of other things that we now are developing together with partners, some of them that we're creating our own, both in the sense that we're production, we're platform, we're doing collaboration with companies that are in this space. But it all starts with the omnichannel and the journey for the individual. And the goal here is, at the end of the day, having individual to be able to log on to Doktor.se, and we will help that individual in every kind of sense and in every area that individual might need. Okay, next slide, please. One of the verticals that I talked about and that we see the most effect now after a little bit over a year that we've been into this is the effect of what we can do with the digital physical solution. We can help them that in an ecosystem that becomes powerful for the individual, that most of the patient that uses these digital solutions and Doktor.se are the ones that really need easy accessible primary care, and that's really what we're catering towards. But we also know that a few of these patients also at either in that specific errand or later stage need something that is more of a physical character, something that is more of depth to go into understanding what that individual need. And we're starting now bundling these clinics with our physical solutions, start asking patients to belong to our physical clinics, and we're doing that really, really quick. That becomes really powerful because once we get that solution, we're also enabling helping our physical care units to take some burden off, because one thing that we know is to operate and run physical care units. That's what we're coming from. That's what we feel comfortable about. And we know that we need to come with a solution that really helps these amazing clinics to take some burden off on their day-to-day operation. And we're doing this really effective by the solutions that we already have. Some of these clinics that we now purchased or got enrolled in our organization has grown really, really quick in the last couple of months, and they really see the effect of what we can do together. So it's really that it's a solution that benefits from both sides, and at the end of the day, it benefits patients that can get accessible care no matter what care level you need. Sometimes it's of a lighter character, and sometimes it's a more in-depth, deeper physical consultations. Next slide, please. The platform solution I talked about, here's a little bit of in the numbers of what we've done. Especially Vibe was something that we launched in June last year in the midst of the pandemic. How quick they grow and how fast things are going for them right now. They're going to keep developing that solution and really having the same philosophy once we kind of betting on a entity or partner, in that sense that we didn't want to be operational in Brazil. We didn't want to conduct healthcare. But this is more of a franchise deal that we have with Vibe, that we're betting on one entity or management team that can really scale and focusing on taking Brazil as the same way that we looked upon our markets that we exist in. And Vibe then are seeing so many opportunities in that market because they are the market leaders right now, and they're scaling so quick that they do multiple add-ons to their service. And once Brazil becomes a little bit more matured, we will see the same effect of the digital physical solution and the integrated model and what they can get further reimbursement. Because at the end of the day, that's from the business point of view, is that created our omnichannel is great for the individual, for the patient, but it's equally as good for the business model in the sense that we're capitalizing on that kind of portal position, getting multiple verticals, multiple revenue streams into our model. And by then we can also see how the platform's scaling. And healthcare is such a huge market in Sweden. As a turnover of almost 700 billion Swedish kroner, and just to narrow it down to just be able to take that revenue from a digital consultation, that was never the plan, and that was never what we thought that was going to be the end game. The end game is being able to kind of produce the entire ecosystem to the individual. Slide, please. With that said, things are going really quick. We're had a tremendous year behind us with that basically we doubled the revenue. We decreased the EBITDA minus that we had down to a very low cash burn that we will see that Sweden becomes profitable for this year. I would say that that's one part that's fairly unique with Doktor.se, that we kind of built the company sustainable, looked upon that really being cash flow positive, which we're now accomplishing in Sweden. And with that, we're going to be aggressive going across Europe. We're launching in Germany. We're heading into UK. We're going to do multiple platform corporations in the near future. So that's the scale, and that's how quick we're going to take these markets now in the next couple of months. I think that was it for me. Presentation. I think we have some Q&A now after this.
Yes, thank you very much, Martin. Really impressive development there. So let me start off with a question about yourself. I mean, you founded the company in 2016. How has your role changed when you have, the company has shifted from startup to this scaling phase? And it's not the usual startup, because you obviously had a lot of clinics that a well-established business, but please elaborate a bit.
Yeah, it's quite interesting, the journey. We started the company in 2016, but we operational started in 2017. We were 2 people in the beginning of 2017, and then now we're a little bit over 800 people. Went into multiple countries. I mean, obviously for me, it goes from being very operational, very hands-on, kind of do it yourself kind of mentality, and jokingly now I said that now it's my role is now more of attracting smarter people around me, which is it's a must in this company if we're going to keep scaling, and that's what I have around me right now. I have a lot smarter people around me in the organization than myself, and that's what I think that things are really taking off. It's a kind of a snowball effect, really. It took a long time to get to the position right now, but in the beginning, it's hard to recruit. People don't know what you do. You don't know about the market. It's difficult to recruit talent, but these days, knowing that we're a fairly well-known brand name in a very exciting market, it's easier to recruit. It's still very difficult in the sense that you don't know what you're recruiting, but with that said, I think that rule changed for me, that it's more setting the team together, and is also more about looking at the opportunities outside Sweden and internationally, and what this company is heading for the next 10 to 20 years.
And should we view Doktor.se as a group of clinics that have a unique selling point, a competitive advantage through the access provided by your technical platform, or should we view it rather as a more digital company where the value is created on the digital platform and kind of the physical clinics are kind of the supportive bit? Or is it a mix that's pretty evenly divided? Or maybe it's just, could be also regarded as an irrelevant question, because the sum of the parts is clearly more than each part itself.
I think I can answer yes and no on each one of these questions. Depends who's asking and how I want it to come across. But at the end of the day, it's going to be really difficult to distinguish what is what. We wanted it to be very clear that what we think is going to be the position at the end of the day is the brand name, and it's the control of the end user. That's what we're going to capitalize on, and finding multiple verticals that we already done in the last year, and that's going to keep growing with the chronicle program, and we're going to see prevention care. We're going to do a lot of these things in a mature market like Sweden. Physical care is obvious that's going to be a huge part of what Doktor.se is. So I don't know if we chicken and the egg. I don't know if we sprung from the physical and became digital, or we started digital, because once we started in 2017, it was 100% focused on the digital platform and the digital consultation. But these days, it doesn't really matter to me. I don't feel like I have to play the charade of saying that we're an AI-based tech company. We're an integrated digiphysical company, and we do what's valued for the individual and the patients, and that's starting becoming good enough into the market.
Yeah, yeah. And I think you touched upon really the most important, crucial, unique selling points in B2C business: trust and convenience. That's how you get the customers. And also, that's a good segue to ask you about your digital platform, because it's a totally different business model than your hybrid digiphysical business model in your two first legs. So would you consider spinning that out sometime in the future?
I mean, yes, we've seen that in the past that happens. I don't know if we really need to do that to kind of clarify it to the market. I think at the end of the day, the way we build things internally is that we look at every market as a external partner to us, even if it's our own operation. So let's say we're going to Germany. We're called Doktor.de in Germany. To me, internally, that's looked upon as an external partnership with the platform. So we're building that catered towards Germany and towards Doktor.de. But in Germany, we're also 100% operational, which we're not in Brazil or we're not in Africa. But the same mentality applies, and kind of the same structure. So whether we're going to spin that out of from the company in the future, we'll see. But the way things are operational handled right now, it's very scalable and it's very functionable right now, which is the most important to me. Then we'll see how we present that to the market.
I see. Thank you. And looking at 2020, you showed some numbers about the virtual care visits that I think grew sixfold. What about 2021? Have you seen any decline in growth, any slowdown? And what can you tell us about your predictions for the future?
I think, yeah, it's been an amazing growth so far, but that's always the same thing with percentage or multiple. If you start from low levels, you're always going to see that hockey stick. Obviously, we're not going to see potentially not the same percentage growth or multiple growth, but in general terms, you're going to see an increase, because this is such an early stage. As we saw on the parallel slide, it's only 2 out of 10 people in Sweden that use the digital consultation. And that's still in a matured market. And once you look at UK or Germany, they're way behind us. And then you look at Europe behind that is even further behind what we see in Sweden. Sweden is an early stage. So that's going to be the most difficult, to converting this analog market into more digital, changing the behavior on the individual basis. We're going to see that happen, but it's going to take some time. So yeah, no, we don't see any decrease in 2021. It's still going with the same force. We also know that the pandemic, even though we see some numbers from our side that was catering toward COVID-19, we also see some effects that we're less sick. We see a lot of symptoms and errands that are not as visual in 2020 as they've been in the past, because we're healthier as a people outside COVID-19. So we'll see how things developing, but we're always going to spend money, and we're always going to consume healthcare. That's inevitable.
Okay, and what can you tell us about competition? How many other players like yourselves are there out there?
I would say right now it's the way we look at it. There's multiple things doing. We're going to see a lot of verticals that I talked about, and we're not going to be the producer of every vertical. And we're going to see a lot of companies sprung from these more niched markets, which is still huge, by the way. because healthcare is so big. With that said, looking at the bigger ones, Kry obviously in Sweden, Babylon in UK, we're on the same level as Babylon in every way that you look at these companies and in turnovers and what we do. We're a little bit after Kry in Sweden, but at the same time, we do have our platform corporations that we do that are scaling really, really quick. So I don't see them as competitors in the sense of I know that we're converting the market together. It's going from analog to digital, but at the same time, at the end of the day, it's always good to have someone in that you're chasing, or someone that you want to beat, or someone that you want to have behind you. It's a healthy competitive market, and I think that's what drives the changes for the future. And I'm a part of it, and I love to compete, and that's what Doktor.se is doing.
Okay, it's time to conclude. Thank you very much, Martin, and good luck on your journey.
Thank you so much.
Take care.
Pleasure. Take care.
Okay. In just a few seconds, we'll welcome our next speaker, Louise Nylén of Dynamic Code. So we are back now with Dynamic Code. With me, I have Louise Nylén, the CEO, and Ann Kihlgren, founder. Welcome.
Thank you very much. Good afternoon. Today, Anne and myself will tell you about how easy it is to take this type of self-sampling. You can look at Anne there. Send it off for laboratory analysis and get the test result in your mobile phone. We'll also tell you how this translates into a business concept and a growing health tech company. So we have one clear purpose, and that is to revolutionize healthcare by giving people greater control over their own health. And as most businesses, they start by addressing a problem in the market. And the problems or challenges that Dynamic Code saw were in the healthcare system. We can see an overloaded healthcare system, an aging population, and people are not receiving effective healthcare. We also see that a lot of providers lack efficient tools to make accurate and cost-efficient diagnosis. We see that patients, they're also consumers, so they demand speed and precision and a smooth system. And also there's a lot of research around that is not coming to the benefit of the individuals. So usually challenges are found by entrepreneurs, and in this case, it was Anne. If you want to give us an introduction to yourself.
Yes, hello. My name is Anne Kihlgren. I'm the founder of Dynamic Code. I'm a biochemist. Before Dynamic Code, I was working at the National Forensic Laboratory, NFC.
And in November last year, I took over from Anne as the CEO after a history of being in several different growth companies, international growth companies, most recently as the CMO and deputy CEO of LeoVegas Mobile Gaming Group, and also the CMO of Trustly. But now, Anne, let's get into the exciting stuff about our concept and the technology behind it.
Yes. First of all, our concept is remote diagnostics. This enabling safe diagnosis in digital healthcare. And our products are new design health tests based off self-sampling and laboratory analysis. And you get the test answer online. And what about our idea and
The reason is, first of all, that it's important how to design these tests. It's important that they are meaningful and they are custom designed. And for example, if you need to take a sample for sexual transmitted infection, you can get a chlamydia test from ordinary healthcare. But there are several diseases, so why test for only one? We have developed a test that we can see 4 different sexual infections from the same sample. This is one example. Another one is celiac disease. We know that in traditional healthcare, it takes almost 4 years to get a diagnosis. There we have developed an own method and test based on both DNA and protein technique that you can give a diagnosis in only 6 days. So the design is important. The other part is the quality and the specificity. The DNA technique, you can detect very small amount of a specific bacteria. And we also design this method that we detect in several parts in the DNA. So even if a bacteria mutate in one part, our test works. And we also have a lot of other controls in our tests too. The third part is that this gives us lower cost and higher gross margin. So this is one important technical issue. The other part is the platform. Louise, please.
Yes. So the entire concept is tied together in our technical platform. We call it the DC platform, which is a diagnostics ecosystem. So this is a technical platform that connects the patient, the healthcare provider, pharmacy, and the laboratory. Everything to provide a full service journey for diagnostics. And this platform also provides us with our seamless customer journey. And I will describe a little bit how it works when somebody purchases our tests or gets it prescribed. There are roughly 2 different customer journeys, and the main differences are in how they are initiated and how they end. So it can either be initiated by a consumer or a patient themselves. They go to our web shop and they buy a test from us. The other way is that a healthcare provider, we work with all the main digital healthcare providers in Sweden today, they prescribe one of our tests. And then what happens is that we send these tests out to the right individual. They take the sample themselves at home. They send it back to our laboratory. We do the analysis, and then they receive the test result in their mobile phone or online. And if it was the consumer who purchased the test initially, they will pick up the result themselves. When they get the result online, they have the opportunity to speak to a digital healthcare provider. So they can click further and get directed to a doctor if they want to discuss either a positive but also negative test result. If it was a healthcare provider that prescribed the test initially, then it will be the healthcare provider that also delivers the test result to the patient. And our tests today are sold through 3 main distribution channels. We have direct to consumer, our own web shop that I just described, where people can purchase the tests. Also, you can get them prescribed through digital or corporate healthcare providers. Or they can be purchased through pharmacies, but also certain health and beauty retail. So a bit about our product focus.
Yes, thank you. Our focus is on the following product category. First of all, it's the precision diagnostics in primary care. And then we have a focus on preventive health and wellness. And we can take the next slide to show, in this picture you see all the products we have today. And in this portfolio we continuously develop new products and new tests. And it's very important that these tests are meaningful. We have tests in women's health, in infection, stomach, and venereal diseases, of course. And we will soon launch a test for HPV and pre-diabetes, for example.
And one of the main reasons probably that we get the opportunity to speak to you here today is our story about COVID-19 PCR. And during early last year, when the pandemic was a fact, the company developed very fast a COVID-19 PCR test. And in May, this was finalized. And already in June, we had an agreement with the the Agency of Public Health in Sweden to start delivering as part of the national testing scheme in Sweden. A month later, we had agreements with a number of the digital healthcare providers as well to supply them with their PCR testing for COVID-19. Since then, we've expanded our lab capacity gradually to be able to deliver on the demand that was out there. In November, we were selected as one of 5 labs as part of the continuous national testing program in Sweden, which is administered by the Agency of Public Health. And currently, we have a capacity of about 70,000 PCR tests per week. And we're also continuously working with the COVID-19 testing, both developing the analysis method for the actual COVID-19 infection, where we can now see mutated viruses as well. We also have our COVID-19 antibody test that we're also upgrading to be able to tell you what level of antibodies you have, not only if there is a yes or a no. So this COVID-19 story, we call it our proof of concept. This was an opportunity for Dynamic Code to show the world how our concept works from beginning to end. We can also see an increased acceptance of self-sampling. You take the test at home, you send it off to lab analysis, and you get the result online. Basically, everybody has tried these types of tests now in the pandemic and understand that this is safe enough and it works well. We also have the accelerated digital healthcare due to the pandemic, where our products are an important piece of the puzzle in order to give safe remote diagnosis. We can see how we create clear value on an individual level, healthcare level, and also for the whole of society. And we've also been able to prove the scalability of our concept. And it's not only us who see the value of the concept, right, Anne?
No, that's true. This is a picture of our partners that we collaborate with today. And you have healthcare providers, digital healthcare providers, as Doktor.se, for example, and pharmacies in Sweden. And all of these, it's very important with the quality of the products. So this we have in common, that the quality is very important. So I think this picture speaks for itself.
Definitely. So what about the future? What does it hold? Well, the concept is in place. We have a strong fundamental to build from. So what we're now focusing on is scaling up and investing. So we're looking at expanding our lab and our office at our headquarters in Linköping. We're strengthening our team and investing in marketing and communication. We're also looking at geographical expansion, where we will be rolling out into selected European countries the coming years. And of course, to continue to innovate and develop. We see ourselves as an innovative company, and we will continue to be on the edge and deliver new types of tests and new methods going forward. And a snippet of some numbers from last year. We went from a revenue of 18.5 million in 2019 to 278 million SEK. Now, this was a very small company taking on the suit of a big company, or a very big suit, and this is of course much due to the agreement with the Agency of Public Health. So if we look at our core business, which then in 2019 was the 18.5 million, we still grew that with 70% to 31.5 million. So despite the fact that basically all our resources, all our energy went into the development of COVID-19, the expansion of the lab, and managing the extremely high pressure during last year, we managed to grow our core business with 70%. So we're very proud of that. And to finish this presentation off, we'd just like to say, do try this at home. Thank you very much.
Thank you.
So, thank you very much, Louise and Anne, and congratulations on a job well done.
Thank you.
Your core business grew with 70%, as you just recently mentioned. Can we expect, what rates do we have to look forward to going forward, and what long-term effects has the pandemic had on your business?
Well, I think we did mention the long-term effects in terms of the increased digitalization of healthcare, where we play an important role. Also, the increased acceptance of self-sampling. So we see that there's a great momentum for our concept at the moment, a momentum that we are keen on capturing. So we're definitely aiming at the same type of growth numbers, or even higher, in our core business for this year.
Wow, that's not promising a little. So I think digital health in general, and your company especially, is a good example of private companies, private initiatives, trailblazing kind of the development of the technology. And I didn't catch, neither in your presentation orally or in your slide where you presented your partnering companies, the region, the Swedish Public Health. Am I correct? And why is that?
Why we didn't mention them here?
Are you working with them? Are you?
Yeah.
Oh,
Well, I mean, we did mention them. They are the reason for the 278 million last year.
But besides the PCR tests, are you working with them, like in the same way you're working with the Doktor.se or Kry or the other?
No, for the Agency of Public Health, it's only for the PCR testing at the moment.
Yes, and is there a reason for this, or?
That's the agreement that we have together with them at the moment. So I think in terms of the traditional healthcare, if you may call it that, they haven't really come to the same level in terms of self-sampling as the digital healthcare providers have.
Yeah. Okay, so let's hope they catch up in the near future, because that was what I thought was going to be my point exactly, that they're not as fast and early adopting to new technologies and solutions as the private sector is.
No, I think that's true, but still I believe that they have caught on a lot. I mean, many of the GPs or local GPs do have video consultation now since the pandemic, actually. So I'm sure, there is a lot of development going on. So let's hope they get to self-sampling as well, because it's a great way to ensure that the resources in healthcare are used more efficiently.
That sounds comforting. Anything you would like to add, Anne?
I mean, this momentum with the pandemic situation is that people trust to take a sample by their own and get a result from a physician. So all can be managed from home. And I mean, we in Dynamic Code, we have a lot of tests and concept based on that, not just COVID-19.
So COVID-19 is basically educating your customers.
Yes,
To sell
you can see it like that, yes. So we have a lot of other tests that I showed you that is working in the same concept.
Speaking of tests, are you planning on providing some kind of aging biomarkers tests in the future, or is that outside your scope of what you think is commercially valid?
It's important for us to priority And I know about this area, and it's very interesting. It could be in the wellness and preventive healthcare. Yes, thank you. So it could be.
Could be. It's
Mm.
possible. Okay. So let me see. You aim to expand to other European markets in the coming years, or perhaps even this year. Is that correct? Or yeah.
Definitely.
Does your business model translate internationally well, or how do you view that?
Definitely. And we're in touch with a lot of international digital healthcare providers, and they all see the value of our concept. So it's very interesting to have these conversations. Then, of course, it's long journeys and long discussions. But we have found that everybody appreciates the concept and understands the value, because as a digital healthcare provider, it's only so far you can get via video. At some point, you will need to take a test for several different infections. And if you can make sure that people can still remain in their homes doing even that, it's a lot of value for both the healthcare provider and for the individual.
Yes, definitely. So it sounds like your expansion is kind of partner-based. You're going to have a partner-based strategy, like piggybacking on healthcare providers that are established already, so you get quick access to a client base.
Yeah, we see that as a good road into the market, but we will also be rolling out with our own web shop, etc. Because we think it's important. Also, we're very close to the consumer and the patient. We want them to also be able to purchase the tests directly if they are worried about something and they want to take control over their own health. But what we do always ensure is that we have a healthcare provider at the end, so you will never be left with a test result and nowhere to go, but always a doctor that can pick you up your questions or your prescription of antibiotics or similar.
I see. Okay. And what about competition? Are there companies out there that are similar to yours?
There are definitely companies that are similar. We see the majority of them actually in the US at the moment, but then there are many labs around, and there are many people who provide test kits, etc. But so far in this region, with this type of product portfolio and complete concept, I think we're pretty unique still.
Can you mention any particular markets that would be interesting for you, or?
We're looking at markets where the digital healthcare providers also are growing and taking ground. So at the moment, I think UK and Germany are interesting markets to mention too.
Okay. You're a private company at this point. Do you have any plans for an IPO?
Well, at the moment we have funds to grow, which is what we will be focusing on and prioritizing, and then we'll see when we need to get financing.
Okay, so any milestones that you would like to dangle in front of the investor community in the coming years that you would be especially proud of achieving?
I think absolutely establishing ourselves outside of Sweden. That will be a huge milestone for us. We're already present in Norway and Denmark and slightly in the UK, but it's still small volumes. So once we sign a partnership or get the volumes up outside of Sweden, that will be a big milestone.
Okay, Anne, anything you would like to add to that?
No, I agree totally with Louise in it. Yeah.
Okay, and on that note, thank you very much both for presenting, and good luck on your journey.
Thank you very much.
So we'll take a short break before we are back with our next presenters. And CEO Ann-Kristin Malmborg Häger. Please, go ahead.
Thank you. Thank you so much. So my name is Anke Malmborg, and I'm the CEO of PainDrainer. PainDrainer is a fairly young company based in Lund, in Sweden. I've been the CEO for 1.5 years, and that's basically the time the company's been in operations. My talk today is titled Digital Self-Management of Chronic Pain. So if we look at the next slide, like I said, we're dealing with chronic pain. Did you know that 190 million people suffer from chronic pain in the US and Europe? And did you know that 40% of all primary care visits are due to chronic pain, and 30% of all sick leave is due to chronic pain? And as you can understand, this is an enormous burden to society. In my next slide, I have some figures on the cost to society. In Europe, the annual cost due to chronic pain is 300 billion euros annually. And the corresponding figure in the United States is $600 billion. And in little Sweden alone, it's 90 billion Swedish crowns every year that these patients cost the society. If you look at the diagram there, you can see that the cost to society for chronic pain is at the same level as cancer and diabetes together, which is enormous figures. And if we switch to my next slide, we can also see that there is an enormous clinical need for the patients themselves. Only about 2% get access to specialized physicians. And there is an enormous opioid crisis out there. A lot of medications are taken, and very many of the patients are afraid of becoming addicted to these medications. And they also worry about the side effects. And taken together, of course, this decreases their quality of life quite substantially. So our solution to that is outlined in the next slide. It's based on the fact that what you do in a day affects your pain level. So we are introducing the first advanced self-management tool for chronic pain powered by artificial intelligence. What you do in the tool, you log your daily activities, sleep, work, rest, physical activity, household, etc. And you also log your pain levels, medium pain and peaks of pain, and your lowest level of pain during the day. And what happens to this data, it's fed into an AI engine, and the AI engine is trained on your behavior, on your personal behavior. And this means that you will be able to get advice from the tool based on your behavior. So you can actually ask your app, for example, I've slept 8 hours and I need to work 5 hours today with a certain intensity. And I don't want to have a level of pain more than 7 today. What more can I do today? And you get suggestions from the tool based on your own behavior, patient-centric behavior. So you can plan your day and thereby get control of your life, get control of your pain, and that will increase your quality of life. If we look at the next slide, this way of dealing with the patients or helping the patients is a clinical practice out there. It's used in the rehab clinics. It's called acceptance and commitment therapy, ACT. So we are building on this. We're doing the same thing as they do in the clinic. But we can reach out to all the patients, not only to the 2% that actually are allowed into the clinic. PainDrainer has developed the tool. It's fully owned by the tool, but we've done it in collaboration with our partners. And our partners are mainly 3 hospitals in the United States. It's the hospital that's connected to UC San Diego. It's Newton Wesley Hospital that's connected to Harvard Med School in Boston. And it's Weill Cornell in New York. And also, of course, we're working with SUS here in Lund. And that's on the clinical side. Working directly with patients with an app, it's very important to have a user experience and something that engages the patients so that they like to do it and they continue doing it. And for that, we have and we are working with Massive Entertainment, which is a gaming company, one of the biggest, or owned by Ubisoft, which is one of the biggest gaming companies in the world, to help us increase the engagement that our tool gives. And we're also working together with a number of other user interface experts. So I spoke about clinical praxis. So if we look at our next slide, I present our first clinical evidence. We have data now from 15 patients in the clinic in San Diego. We followed them for 6 weeks, and we will follow them up to week 12 as well. So we measure at time 0, time 6 weeks, and time 0. There are 15 patients, and the endpoints are increased quality of life and decreased pain levels. And you can see that 2/3 of the patients experienced an increased quality of life, and 2/3 of the patients experienced a decreased pain level. And this is very promising result. It makes us really, really happy. When you go to pain rehab clinics, the corresponding figures are about 40%. They measure the same endpoints, increased quality of life and decreased pain there. So we're following the same route. So this encouraged us tremendously, of course. So we are now recruiting patients in New York. We have allowance for up to 60 patients there. And we just got clearance as well in Boston to start recruiting patients there for keep adding on to our clinical evidence. In my next slide, I have summarized some distinguishing features behind PainDrainer. It has a high accessibility. Like I said before, we are not only providing this rehabilitation program to the 2% that gets into the clinic, but to all the people out there. It's a digital tool, it's inexpensive, and it can reach out to everybody that wants or needs it. It gives you, like I said, individual advice. The software adapts to each individual person's. You get advice based on your behavior, not on the behavior on some average chronic pain patient. And this is also the reason why we have been able to file a patent on this concept. You might know that patenting software is not the easiest, but the concept around this patient-centric advice is patentable. It's based on ACT, acceptance and commitment therapy, like I said, so we are not inventing anything or finding out something ourselves. We are basing our tool on clinical principles. It's drug-free. Obviously, since it's a digital tool. This is important, like I said, because of the opioid crisis that we see mainly in the US. We have clinical evidence. Our first 15 patients have reported their results, and we are keep on going with the trials. Boston will open up shortly after New York, and SUS is still closed due to COVID, the pain clinic there. Hopefully it will open up during the fall. We have a regulatory classification. It's medical device class 1 and CE certified in Europe. And in the US, we have from FDA a mobile medical device class 1 classification, which means that we are allowed to sell in the US as well. So talk about selling. Let's look at the next slide where I've outlined the gist of our business model. Now that we have proven the concept in the clinic, we are reaching out in the business to business segment to leverage on our clinical collaborations, mainly in the US. And in parallel, we are opening up to the consumers, so to the business to consumer segment through subscription through our web page. We will also launch after the summer through App Store and Google Play. So taking all this together, I've tried to summarize in the next slide the need that I spoke about, the many patients out there suffering from chronic pain with the low accessibility to the pain clinics, the low quality of life, the enormous cost to society and the opioid crisis. With our solution of high accessibility, which is based on clinical praxis, we have clinical evidence. The tool helps the patients to increase their quality of life and bring them back to work. And like I said, it's drug-free. So together with our business model, this will bring PainDrainer out to the users and result in revenue to the company, of course. On my next slide, I want to emphasize that sustainability and social responsibility is important to us. It is an environmentally friendly product since it's digital. There is no transportation or anything like that. It's inexpensive and available to the vast majority of the patients out there. Basically, anybody can afford it. The majority of the patients are women, so we're reaching out mainly to women. And like I said, there is no risk for addiction because it's drug-free. In my next slide, I've outlined the board of directors and our advisors. I've learned from my years presenting startup companies that it's important to show who is responsible behind the company and the founders of the company. And the chairman of our board, Carl Borebek, together with Göran Backfors, who is a deputy member of the board, they are the founders of the company, together with a woman called Maria Clement, who is herself a chronic pain patient. We have on the board also Hans Lindroth, who is behind an app called Fishbrain, and also Peter Benson, whom you might know from a Sunstone background. Our advisors come mainly from the clinics, like I spoke about. They're doctors and psychologists in our collaborating clinics. And we also have a collaboration with Mattias Olsson, who is the first professor in artificial intelligence in Sweden. So we are now, we made a soft launch in December in Sweden to reach out to see and to collect input from the end user out there. So if we look at my final slide, having now the clinical evidence, like I told you about, we made a soft launch. It gave us a lot of input on how to upgrade the interface so that the tool can be used outside the clinic. In the clinic, you have the nurse holding your hand, calling you in the morning, reminding you of what to do. If you buy the app through our webpage, you are alone with it, so it needs to be self-explanatory, and we're working on that, and we'll launch in Sweden after the summer. And we are now also reaching out to attract capital to be able to launch in the US towards the end of the year. That's my story so far. Thank you.
Okay, thank you very much, Anki. A very interesting presentation.
Thank
I had
you.
no idea pain was such a huge problem for the society. Diabetes and cancer combined. That's
Yeah, no, I must confess, I didn't know either until I started working on this.
Yeah, I see. And you also touched upon two of the characteristics of digital health: accessibility and personalized medicine. Makes you fit very well into this segment. So could you tell us a little bit about the idea behind the company and why it was founded?
Yes, it was actually Carl Barebek, whom you might know. He's a professor in cancer research. It has nothing to do with chronic pain, and he was working with Maria, who is also within cancer treatment, and she has a PhD in some biochemistry, I think. And she had an accident and hurt her back, and came into pain rehab. And she was, of course, frustrated that she couldn't go back to work, and she was happy that she could go into the rehab clinic and learn about that sleep is important for me, physical activity is important for me, and it's important to value what I do, etc., etc. But then she came back home, had to go back to work. She has 3 kids. She has so many things to do, and she was like, I don't know how everything I do, how they connect and affect my pain. I know some days I do something wrong, but I don't know what I do because there's so many things that I do. So she was like a little bit frustrated and complaining to her boss, who was Carl. And he happened to know Göran, who has a software programming background. And they started thinking about this. And Göran said, well, we could build a tool for this, of course. And he started programming in the night, and they decided to go to the US and speak to those pain specialists to make sure that they built something that was based on science. And so it started. And here we are.
Yeah, I think storytelling is a very effective way of presenting something. So I think you should include that in all your presentations going forward.
like an opener.
Yeah, definitely.
Yeah, it's a nice story in that way. It's terrible for Maria, of course, but
yeah, and I think migraine is included in your kind of what you cover, right?
So what did you say?
Migraine, like that's one of the pains that you can know.
No, actually, we are not fully convinced that activities affect migraine. It might do, but we've said so far that we are excluding cancer-related pain and migraine.
And how about stroke patient? Could you help them with a app like yours with gamification for their rehab?
Absolutely. I don't think we could do it in the shape it is now, but we've built the AI engine and the input data and output data in a way that you can adapt it to other indications. And I guess that for stroke patients, you will have to measure somewhat different parameters, but the concept and the AI engine and the back end would be the same, and you can change the front end and what input and output data you get. So yes.
Okay, and moving on to your app, you mentioned you had a CE mark and a FDA approval that allows you to market the app in the United States. Are there any other marks or approvals you could get to strengthen your marketing or your claims, or have you reached your goal there?
For the version that we have now, I should say that we also have registered trademark in Europe, and we have a trademark application in the US. So that is important, of course, to protect your trademark. But from a regulatory perspective, the version of the app that we have now, the regulatory clearance in Europe and US are okay. But our plan is to expand the tool to register intake of drugs and also open up a window for the treating doctor so that him or her can look at the patients and also group patients together, and basically to be more efficient in what patients they want to see, and maybe if patients are feeling good, they can see and they can wait for the appointment with them. And for such expansion, we will need an upgrade in regulatory. So that is our sort of next level of product.
I see. what do you see as the key to successful introduction of digital technology such as artificial intelligence in healthcare? Pretty wide question, but what do you think must be in place?
I mean, artificial intelligence is the fashion word. It's used a lot. We're constantly making a competitive analysis, of course, and there are a number of tools out there claiming that they are using AI, but when you look at them, they're basically just diaries. So if you want to go out and claim that you're working with artificial intelligence, you have to work with artificial intelligence for real and communicate about that. But the most important thing, I think, is the result. And in this case, that you can train personal data and give personal advice. It's like each patient or each user will have their own brain in their tool that is tailor-made only for that person. And I think that is really the patient-centric enormous benefit from that technology.
Yeah, of course. So the results are key.
Absolutely.
How many observation does your AI need to provide, to make a difference? Is it enough with, 5 observations? Sounds pretty thin. Or is it 100 or?
The logging that you do in the diary are 19 parameters. So it's 6 main activities, and within those activities, it's time, your experience of the activity, and the intensity of the activity. And taking that together, you can start asking questions.
Yeah, but is it after 1 week or after 1 month or?
We see that the AI engine needs to converge to be able to give your results. We see that on average it takes 8 to 10 days.
Okay.
It depends on your lifestyle. If you lead a very irregular life and do very different things from day to day, it takes longer. And if you're very sort of doing the same thing every day, it's easier for the AI engine to converge.
Okay. And so you're planning on launching in the US. What is your opinion on your expansion? I mean, you think it will be easy? Is it like easy to convert your business model and apply it in the US? Are there a lot of competitors or basically none? What does that look like?
Well, you always think that things are easy until you start getting into the details, and then you realize that nothing is easy. But since it's a digital tool, we will use those channels, our webpage, transforming it to a US setting, of course, with language and all the rules that apply there, and also through Google Play and App Store. That these are global channels. So for that sense, it will work. But there are legal things, of course, and things that you need to have in place, and insurance and everything is a total different game out there. With respect to competitors, there are competitors, pain apps that are diaries. We updated only last week our competitive analysis. We can't find anyone that has an AI engine coupled to the diary so that you can actually get advice and you can coach the patient. We haven't found anyone so far. So, yeah. But I mean, it's an emerging technology.
Your expansion in the US, will that be kind of a what will be the growth drivers? Is it pure marketing that you will, spend money on marketing to acquire customers? Will you have partners, or are there any other growth drivers or strategies that you could elaborate on?
We will work on the digital tools like the normal search engine optimization and marketing through digital channels and social media and all that. But being a small company, it's hard to put too much money on that since you don't have that amount of money. So we will leverage on our contacts since we have both New York, Boston, and San Diego with the contacts there. We will try to leverage on their contacts, and they are very much engaged in patient organizations. So those are the routes that we will reach out through as a first step.
All right. And will you be or not be eligible for reimbursement from public funds, or how does that work?
I think we will. I think we can go that route, and that is something that we are investigating. It's a long process, so we are focused now initially on getting the tool out as quickly as possible and to gain input from the users so that we can make the tool as good as possible. But it's in our plan for the future to get into the reimbursement system if possible. Yes.
Okay. And so finally, with your experience of companies like Sensagen and Alligator Bioscience, what do you believe are the most important factors when scaling up a business such as PainDrainer?
There are many important factors. You have to move quickly, especially in the digital world. I think you have to move even quicker than in traditional, in my world, traditional businesses. So move quickly. It's very important to find the right people to work together with, to find collaborators and have the view that you are the core team, but there are so many specialist knowledge out there that you cannot employ, but you have to collaborate with them. Like, for example, we are collaborating with Massive Entertainment, which is a very interesting angle, and they are really experts in something that we need. So respect for that. You have to buy, being a small company, you have to buy all those things that you cannot harbor inside. So find the best people, create a core team, and buy the rest from outside until you have the revenue or the finances to be able to employ.
Okay, thank you very much once again for your presentation.
Thank you.
Good luck on your journey.
Thank you so much.
Okay, so we'll now go into yet another short break and be back soon. So welcome back. With me now, I have Erik Alhanko, CEO of AsthmaTuner. Welcome.
Thank you very much. Thank you for having me. My name is Erik Alhanko, and I am the CEO of AsthmaTuner. We have developed and patented the only CE-marked app for self-instructional use for asthmatics and other respiratory diseases. AsthmaTuner was founded at the Karolinska University Hospital in a collaboration with the Karolinska University in 2014. Our two founders, Dr. Henrik Ljungberg and Associate Professor Björn Nordlund, had more than 20 years of experience in treating asthma patients, and that they developed a tool in order for them to save time. Last year, the team behind AsthmaTuner won the Athena Prize, which awards the best innovation in healthcare that has come up in a collaboration between healthcare, research, and business. Asthma is the world's most common chronic disease, affecting 10% of the population. Asthma is triggered by many different triggering factors, for example, pollen, that is causing an inflammation in the lung function that typically varies from one day to another. Different level of asthma should be treated with different doses or even different types of inhalers. And that is tricky for patients today to stay in control. There are very clear international guidelines on how asthma should be treated, how patients should step up in treatment when they're feeling worse and step down in treatment when they're feeling better. However, those difficult treatment decisions are today taken by the patients themselves at home. On the positive note, however, is that almost all patients could be entirely symptom-free if using the right medication. Asthma is also one of the most costly diseases in the world, and a huge cost driver is the frequent recurring visits that is required by the national guidelines. Asthmatics should visit the healthcare several times a year, and in those visits there are certain required elements that needs to be included. For example, lung function measurements, symptom scoring, and also treatment plan assessment. The founder's idea was that to develop a tool to help patients make those assessments themselves at home, and therefore saving costs. So AsthmaTuner is a tool that helps patients empower them in their disease. Our application, together with our spirometer, that is the lung function measurement device, measures lung function and symptoms according to international guidelines. And in just 3 simple steps, the patients get an objective feedback of their current asthma control level and also pictures of the correct dose and inhalers that they should use in order to stay optimally treated that day. We have studied and tested AsthmaTuner in several clinical studies on both children and adults. And the results show that our digital tool both improve asthma control and improve adherence to treatment. When asking the children or the parents to the children that has been included in our study, 2 out of 3 report that they actually can attend more days in school while using AsthmaTuner. In 2019, we published our results on improved clinical outcome. And here we could see that we could reduce the share of patients with uncontrolled asthma, that is the red part of the bar on the slide, and in the same way improve the share of controlled patients, that is the green bar. And several clinical studies from across the world has shown that uncontrolled patients cost about 10 times as much as a controlled patient. So there are huge economic savings to be made here. In 2020, we published our second clinical study on improved health economy. And here we showed that our tool reduces the time for assessment of asthma and also the actual working time for healthcare professionals. In the past year, we have developed the tool further, and now we are a complete tool for digital asthma care, including the treatment plan, the home spirometry, which is a more advanced lung function measurement, and also asthma diagnosis. We are very proud to be the only medical app that has a sensor that is now included in the national reimbursement system here in Sweden. And we are also very proud to be the only medical app that has gone through an evaluation by the SKR, the Sveriges Kommuner och Landsting, that has resulted in a recommendation to the public health care to use our application. We started and launched AsthmaTuner on the market about 3 years ago. And we sell the product business to business in a subscription model to healthcare providers. Our customers range from the public healthcare regions here in Sweden to university hospitals, specialist clinics, and down to single primary care centers, and also pure e-health providers. Our patent was granted last year in the European Union, and some Asian markets has followed, and we're now waiting for our pending patent to be approved also in the US. Meanwhile, we have launched AsthmaTuner in the other Nordic countries and are now looking to international further. Last year, more than 100,000 lung function measurements were recorded and stored by our users in the AsthmaTuner system. This data is of course very interesting, both from a research perspective, but also for us when we're developing more advanced functions in AsthmaTuner. On the picture, you can see our co-founder, Björn Nordlund, on the national morning show Nyhetsmorgon 3 weeks ago, where he presented data that shows how asthmatics feel during the pollen season. This is absolute unique data, and we're looking forward to receive even more of that data going forward. 2 weeks ago, we also published and presented our new collaboration with Novartis. Together with Novartis, we'll now develop the product even further, expanding into the severe asthma and severe asthma features. Those patients are those with more advanced treatments, for example, biological treatments. We're together with Novartis developing AsthmaTuner to support those even better. The data that we get and the possibility to both identify and monitor asthmatics is of course very interesting, both for healthcare professionals and for pharma companies. We are now planning for our next financing round that will take place later this year, and we are looking for investors to join our vision to empower patients for more cost-effective care. With the new funding, we will intensify our implementation here in the Nordics, but also launch AsthmaTuner on a number of selected markets. We are currently a team of about 15, primarily based here in Stockholm, Sweden. It's a great mix of medical experts and skilled software developers, and we are now looking to expand even further. Thank you very much for listening.
So thank you very much, Eric, for a very interesting presentation. Let's go to the questions now. The current corona crisis, how has your business been affected, short term and long term?
I think from looking back a year ago, we had no contracts or no central contracts with the regions here in Sweden that are our primary customers in order to scale up and implement on a broader scale. And now we have 6 of those. So I think the corona pandemic has very much accelerated the need for digital solutions. We are in respiratory care, and treating asthma patients often include those lung function measurements, which has been quite restricted due to the risk that both for patients and for caregivers when doing those spirometry assessments where you empty your lungs from air completely. So our tool has provided a great support for doing the same tests at home instead. So nurses can sit at home in a risk-free environment and provide patients with instructions over video to do those assessments. So from that sense, I think the corona pandemic has sort of accelerated the implementation of digital solutions. Of course, however, during the peaks, it has been difficult for us to get the right attention and to sort of have the right focus with our customers in order to change processes, etc., since they have been fully focused on more emergency care. We are handling or the doctors that we are talking to are lung doctors, and those are often in the first line to be included in the more emergency care in this pandemic.
I see. And you mentioned that you are now collaborating with 6 of the Swedish public regions. Do you have other partners that you collaborate with or planning to collaborate with?
Yes, for example, we have a national partnership with Min Doktor, which is a pure e-health provider here in Sweden. So in that partnerships, patients can go online and get their treatment and an online consultation with a doctor and get our hardware sent home to their address. And we also have additional private partnerships that are not yet public, but hope to be public soon here.
Okay, good. So you have expanded in the Nordics, and you're planning a market launch in selected European markets. And how well does your business model translate internationally?
I think the guidelines that AsthmaTuner is built upon is from international guidelines. So I think the solution from a technical perspective is already a great fit. It's just taking in the solution, do necessary, of course, language translation, but it's the same guidelines and same requirements in other countries. So that's a huge benefit, of course. From a business model, each market in Europe and also in other parts of the world are of course different setup in terms of who the payers are, who the decision makers are. So we are evaluating different business model on different markets. For example, if we should go to a business to consumer track in specific markets. But I think from a European context, we are primarily looking at Northern European countries. I think the current business model that we have sort of get adapted to and are quite comfortable with here in Sweden will be applicable also in those markets.
I see. And what about the potential, Sweden contra Nordics contra some, let's say, Germany or other interesting markets in Europe? How do you compare those? How can you compare them?
Asthma is very evenly distributed across the world. So about 10% of the population here in Sweden and also in most other countries suffers from asthma. It's considered one of the most costly diseases as well. And what is different from asthma compared to many other chronic diseases is that it's at least as common among children and young adults as in the older population. And I think from a digital perspective or from how comfortable you are with using digital solutions and online consultations, for example, I think that's asthma will probably be one of the chronic diseases that are first fully digitalized. And from that sense, I think we here in Sweden have, of course, coming from being quite advanced in digital healthcare, but we are now seeing that other parts of Europe are rapidly catching up, and some of them have even passed us, I would say.
Oh, interesting. Could you give us some numbers as to your size, sales, margins, etc.?
Since we're a SaaS model, we have a very high margins. We are increasing our monthly recurring revenue by more than 10% a month, and has been doing so since a year now, and have more than 3,000 patients that are using our tool actively.
Okay. Are you considering an IPO?
Yes, we are considering an IPO. We haven't decided fully if we should do that in the coming round or start preparing for that in the coming financial round, or if we should wait to the next round. But that's discussions that we have ongoing in the board at the moment.
Okay, very interesting. And finally, what can we look forward to from AsthmaTuner in the coming years, sort of, if you paint us the big picture?
I hope to be, and I hope that AsthmaTuner will become one of the great exports of Sweden in terms of digital care. I think there are no other solution in the world that has the features that we do. So our primary feature is that we provide those instant instructions without a doctor's input. And we really think that if healthcare is going to be more efficient, we need to empower patients more and to ask the application really for an assessment and provide feedback, your individual instruction on how you should treat yourself today, or how you should step up and down in treatment, or how you should, for example, live your life in certain ways. So we want to build in more of that, more advanced features. We want the app to be even more learning your behavior, your patterns, and in the future also provide more predictive advices for you on how to stay in control of your asthma and to reduce your symptoms as much as possible.
Like including estimates of pollen in the air, etc.
Yeah, we already have pollen and weather forecast in the app, so that's already included. But also looking at your lung function, we can see that there are some predicting powers in that, and using this longitudinal data, there are really cool things that to be done with a large number of data and using the right machine learning algorithm, etc. That could be really powerful and taking really the care to a next level.
Wow, that sounds really interesting. Looking forward to following the company and see what it looks like in a few years' time, and the product especially helping the patients. So once again, thank you very much, Eric, for coming, and good luck on your journey.
Thank you very much for having me here.
Okay, let's go to a short break before we get back. Time for Visiba Care and CEO Johan Gustafsson. Welcome.
Right. So yes, thank you for having me. My name is Johan Gustafsson. I'm the CEO of Visiba Care, and I will start my presentation. So I guess we can move on to the next slide. So yes, I will just start by mentioning what is Visiba Care. We help healthcare organizations to provide care with increased quality, efficiency, and accessibility through our virtual care platform. We can move on to the next slide. The reason we exist and our purpose as a company is empowering healthcare, improving lives. And we were founded back in 2014. Have sort of been in contrast with the other sort of online doctor companies that showed up at that time. We became the option for the traditional healthcare, the public healthcare, to find their own way using our technology with their own healthcare professionals to connect with their own patients. So it's a virtual care platform used by a large part of the public healthcare in Sweden, and that's what we are all about. We do not deliver healthcare services ourselves, but work as an enabler through our technology for helping the existing healthcare. We can move on to the next slide, and I can give you just short of in short about us as a company. As I mentioned, we were founded in 2014. We're currently around 70 employees with offices in Gothenburg, Örebro in Sweden as well, Oxford and Oslo. We have a bit more than 60 customers with more than 30,000 professional users spread across more than 2,000 care centers. Our customers are based mostly in Sweden, but we also have customers in Norway, Finland, UK, and the Netherlands. And the business model is B2B SaaS with more than 90% recurring revenue. Let's move to the next slide. Being in the market for quite some time now, we have established ourselves as the leading B2B virtual care platform provider in Sweden, working with 12 of the 21 regions in Sweden as our customers. We have several of the biggest private healthcare providers. Among them are Aleris, Capio, and GHP as customers. We work with 2 of the 3 biggest occupational healthcare providers, both Previa and Feelgood. And although not in a big market position yet, but definitely see that municipalities is an expanding market for us, where we have some pilot cases ongoing and can definitely see big potential moving forward. We can move on to the next slide. The long-term goal for us as a company is to enable efficient and accessible healthcare for 300 million people. And yeah, we can move on to the next slide as well. So and a first step towards that, of course, was taken during the last year. We have had a very, very strong year during 2020. We've showed very strong growth in all the key metrics in all markets and all segments. We grew revenue with 253%. Of course, very, very strong. And we could see very, very strong growth both in Sweden, where we have the biggest customer base, but also in other markets like Finland, Norway, UK also grew very, very strong. The user base in our platform grew with 568%. And I would say it started a little bit over a year ago. So on March 11th, 2020, when the pandemic really started to take effect, we experienced growth on a daily basis, similar to what had previously been a strong month for us. So in terms of both users, of revenue, and the growth of patient cases being managed through our platform, just saw tremendous growth. Patient growth was 662% last year. So it was a very, very strong year. And of course, one had to ask, is the growth sustainable, or what will happen? But pretty much after a slightly slower summer, we've had really strong growth all through the fourth quarter of 2020, but I've also started the first quarter of 2021 in a very, very strong way. Keep adding those high growth numbers. We can, and I think also worth mentioning in this is although that we are mostly historically targeted primary care, and I would say primary care is the space in healthcare where sort of online consultations have given the most attention or the most media. But where growth has happened the most during the last year has not been in primary care, but rather in secondary care. Looking at many different kind of use cases with pre-op, post-op consultations, follow-up meeting in outpatient care, and not to say the least that secondary care does a lot of group consultations or group coaching of different kinds in treatment plans, and that's been a very big usage for healthcare as well, to adopt multi-party video calls and expanding that in different areas of their operations to just keep patients out of hospitals when you need to, basically. We can switch to the next slide. Adding to sort of those revenue growth, the annualized recurring revenue for us has seen really strong growth. It hasn't been slow the previous years. I think we've had strong growth for many years, but the numbers we could see between 2019 to 2020 was of course remarkable. So we were just slightly over 20 million ARR after 2019. And closed the year of 2020 on 75 million ARR. As mentioned, the first quarter in 2021 has been strong, so we're right now a bit over 80 million and keep growing, basically. So I think we can consistently see strong and continuously growth during the pandemic. What has been perhaps an interesting thing an interesting insight during the last year and during the whole pandemic is that growth tends not to come so much from new accounts, but rather a large expansion in all the sort of large enterprise accounts that we have been working with for many years. And what many in healthcare are explaining as some sort of 2-year jump in the future, the digital transformation that healthcare had hoped to achieve within the next 2 years has been achieved in just a couple of months during the pandemic. So it's been sort of a really strong jump forward into the future, and hopefully, and we are convinced that that is something that we will continue to sort of see, and it will not move back into where it was when the pandemic started. We can move on to the next slide. We consider Europe to be our market in focus, and it is a growing market with a quite large addressable market size. We're currently the home market, Sweden, we expect that to be worth around 400 million. Where we consider our markets today, which is Nordics and the UK, it's a market value of around 3 billion SEK. And we expect the European market to be worth around 25 billion, roughly estimated. But that's the ambition for us as a company, to build this company into a European champion and continue expansion on selected European markets moving forward. We can move on to the next slide. So talking a little bit about the product offer that we have, I would say it has some core platform capabilities. The first part would be a communication platform, which is where we started. We are very strong in enabling video consultations in healthcare, both between patient and provider or several parties, where we can include interpreters or different sort of, we can have a nurse and we can have a doctor, we can have relatives and the patient and so on. But it can also be asynchronous communication with that is more chat-based like. I would say that's in our core. What we have developed since 2018 and launched and went live with this fall is an AI-based triage and medical history tool that we call Red Robin. And that is basically a way to automate a part of the patient journey and deliver that as a powerful decision support tool for healthcare professional. It comes in the form of a chatbot-like feature where patients are asked questions on their health and how they're feeling, and depending on the answers, the healthcare professional receives a summary of all the answers and a recommended or likely suggestion on diagnosis. This is something and a tool we believe will create great value for our customers and in healthcare moving forward. But probably one of the biggest things with what we do that is very unique is the way we can configure and optimize different patient pathways for many different kinds of areas in healthcare. We started this already in 2018, looking at that we had a number of customers using our communication platform, and many of them were Swedish regions or very large healthcare providers. And what they had in common was that they have a quite complex organization. They had perhaps a number of hospitals, they had a large number of primary care facilities, and a number of other areas in their healthcare offering as well. And the problem was it was difficult for them to build out digital offers when the operations or the structure of the organization was so complex. So that was when we delivered our sort of enterprise-like offering and enabled them to configure and build patient pathways completely designed according to how they wanted to offer their patients a way into all their hospitals or all their primary care facilities, where we can do that in a number of different ways, very, very flexible and very adaptable to each customer. And then everything is delivered to our customers in a white labeled patient app. So we have around 70 apps out in Google Play and in App Store. Each one is built on the exact same code base, but it has our customer's unique brand and unique configuration and design on it. That way, patients feel comfortable connecting with their own healthcare provider and using their services rather than coming to us as a tech provider. So we've seen that to be a very, very successful way forward. And we believe we are perfectly positioned to expand this product platform with our broad customer base across both primary and secondary care. I think we can move on to the next slide. So looking at the future of healthcare for us is about enabling real patient-centric care by utilizing the power of technology. You can push one more time, so we get up the next part. You can do that 2 more times and we get the full picture. Thanks. So to begin with, we are working with sort of a way to approach this is that we believe that healthcare in the large majority of cases will always start digital. That doesn't mean that all healthcare can be digital, but it will start with some sort of digital touch point. But to the largest extent possible, we believe we need to make healthcare digital when it can and physical when that's required. So that means that we constantly look for ways to enable more healthcare to be delivered in a digital world. For example, it could mean that we will need to enable some more vital parameters to be able to be sent in prior to a consultation between a healthcare professional and a patient, because if we can deliver more vital parameters, more of the consultations can actually be managed digitally without the need for a physical consultation. So that's just one thing that we try to enable. But we also believe that we need to help healthcare be more efficient by automizing. So enabling more automated healthcare is an important part. And that can, of course, be achieved with building great AI technology in different parts of healthcare, which we're already doing, and we will continue to invest in that area. But I would also say that the patient is probably the most underused resource in healthcare. So just allowing them to fill out some of the information, answer some of the questions prior to consultations in both primary and secondary care will enable a large part of the automation that is needed. Thirdly, healthcare needs to be integrated. We have a challenge today with healthcare being too fragmented, and you have primary care working in one area, and you have secondary care working on their side, and then thirdly you have home care or the care delivered in municipalities or similar, or care homes outside of that. But we are working to connect all of these different stakeholders around the patient to allow for these cross collaboration, team-based workflows that are truly patient-centric, which is very, very important, I believe. And the last part, which I believe is slightly further ahead in the future, but not definitely worth mentioning. Moving forward, healthcare needs to move to a more preventative mode, where you can use connected devices and AI models to continuously feed in information around patients and intervene before they get sick, because that will improve patients' health, and it will save healthcare a tremendous amount of money. So that's a fourth area that we are looking into and definitely see we will be a part of moving forward. But let's move on to the next slide. That is actually what I was going to present. So having said that, I'll be happy to answer any questions. We have a couple of minutes left here.
Yes, thank you very much, Johan. Very interesting presentation, not least the financial development of last year. You went into that in a lot of detail. So it sounds to me, and correct me if I'm wrong, if that has propelled you to a new plateau, so to speak, in terms of revenue. So I guess you would expect more normal growth from these levels on, but it's a new kind of plateau, or how would you put it?
Well, yeah, I would definitely agree. We don't expect 250% revenue growth this year as well, although it would have been amazing. Yeah, so we expect strong growth, but not in the areas of what we could see last year. and as mentioned, a lot of the growth we saw was from customers we already had when we entered 2020. We believe that 2021 will be slightly different in terms of more new sales coming in. And what we could see happened in many markets was customers or healthcare providers that had no real relationship or tried to implement a more complex or comprehensive virtual care solution, but rather just took something they had at hand when the pandemic hit. So there's quite a lot of poor free video conferencing solutions being used in healthcare in many different markets, in hospitals and primary care facilities. And they are now, when the pandemic are sort of phasing out, will be looking for more mature, comprehensive solution, because now they are used to working digitally, but they want the best solution for it. And that will be a great market opportunity that we will try to seize. And I think that will enable us to get more new sales on this year as well.
I see. And how do you view the competition? Let's start with Sweden. Are there any players that are similar to you that you view as competitors?
Well, of course, it would be strange if there wasn't any competitors. Probably the two companies most similar to us are Doctrin and Platform24. And I would say perhaps that we are similar in the sense that we deliver similar solutions to primary care, but our competitors has not yet really seen the success we have in secondary care, where we are very, very big today. But in many aspects, quite similar.
I see, yes. And looking at it from an international point of view, you've entered UK and the Netherlands. What does the competition look like in those markets? And is it regional players or more pan-European players?
I would say UK is a quite competitive market, as it normally is. So there's a number of players there. I would say most of them are have a relatively immature product offer, and I would say it's connected to that market being more not as mature as Sweden, and healthcare to a large extent have wanting technology that would keep patients out of healthcare rather than enabling increased accessibility. So there's been sort of a different approach to it, but it is about to change. And given that Kry has seen some success in UK, Babylon is growing there, and they have a very sort of increased accessibility approach to adding value to patients. I think that will affect healthcare as well, and the NHS. So things are moving forward, and what we can see so far in terms of pure technology providers, we have a very strong product offer. Then of course it always takes time to enter a market and build brand awareness and getting things to happen, but we're on the right path. I'm convinced of that.
I see. And what about the rest of Europe? nationally, or what is perhaps is the better word?
I mean, historically, we have, when entering a new market, we have done it in a relatively traditional way. We have set up a local office and hired the first sort of country manager, getting the sales team up and running and starting doing the legwork. It's large enterprise sales and it's healthcare, so there's no real shortcuts. Of course, you can look into partnerships and to see if you can build local alliances with EMR providers or similar, and we approach that in the ways you can to sort of find ways of moving into the market. Nothing in there has changed, but we continue to evaluate the best ways forward in entering new markets and are open to different opportunities and ways of moving forward.
I see. And you closed a financing round in September, and you have mentioned that you're evaluating a future IPO. What is the latest about that?
Yeah, that's right. We did close the round. We're sort of well capitalized at the moment, and there's no immediate plans on an IPO. I would say nothing has changed since the last statement, that we see it as an option, but there's no decision to be taken at the moment.
I see. Okay. And if you could just tease our imagination, fast forwarding time, let's say 3 years, what will Visiba Care look like then?
Yeah, well, in 3 years, I would say it has become a lot more clear that we are the European leader in this space, and we will be established in a number of new European markets that we are not currently on. And we are a lot bigger than today, but I wouldn't go into more details than that.
Okay, so thank you very much and good luck on your journey.
Thank you very much.
Okay, we'll take a short break and we'll be back soon. Welcome back. Right now it's time for Natural Cycles. CEO Raul Sherwitzel. Welcome.
Hi. Am I live? I don't see the slides, but I can also go without.
You're live.
Hello?
Yes.
Okay, great. Okay, so, and can I ask if the slides are up?
Yes, we can see them.
Okay, good. Okay, so it's just me who cannot see them, but that's okay. So thank you, hi everybody, and thank you for the invitation. It's always a pleasure to work with Sweden. I'm currently based in the US, and before that I lived 5 years in Stockholm, where we still have most of our operations. And one of the things I learned from living in Sweden was the efficiency. I really think that this is kind of deeply ingrained in the culture and the way of working, and that's something that I miss here, but also something that we try to keep in the company as we scale. So I guess you can go to the first slide, the next one, which has the mission statement on it. Very briefly, Natural Cycles is a company which is 100% focused on women as a customer. So we trying to solve big problems in women's health, digitally ideally, and by providing very personalized insights about the health so they can take important actions. I think what we get excited the most about our Natural Cycles is to develop products that in the end can either compete directly with a drug or complement them, or do to take part of the work from a doctor and do it through algorithms. That's really the core mantra of Natural Cycles. The next slide. I have to think about what it shows, but I think it shows that we have the history of Natural Cycles dates back 7 years. I'm the co-CEO and co-founder, and I started the company together with my wife. She's also the co-CEO, and we both from our PhD and postdocs in physics. So really our core skills lies in data analysis, algorithm development, validation through research. and so, for instance, Elina was one of the worked at the CERN experiment where they discovered the Higgs boson, and she worked exactly on that discovery. And I mean, in the end, like, the usefulness of this discovery is up for discussion, but what they've really done is that they really had to push the limits of technology, data analytics, and many other things, to even computing, to be able to perform this analysis, right? And I think many people call this the most advanced statistical analysis ever performed. It was really looking at a needle in a haystack, very messy data, and trying to filter out the real signal that will ultimately be the Higgs boson. And so that's kind of the core skills that we brought over into the field of women's health. And so we started developing an algorithm that initially started to address the problem of contraception. So the problem we wanted to solve was to make contraception hormone-free and yet effective, which was not existing at that time. And so we developed an algorithm that would take body temperature and other biomarkers into account to tell women whether and when she's fertile. And then we packaged this as a form of an app and distributed it directly to the consumer, and that's how Natural Cycles was born. I think one of the key things that we did differently from all the other competitors in that space is that we always were very focused on solving the problem to really solve the problem vertically, like from the start to end, digitally. So like with Natural Cycles, you don't need to take the pill anymore. You can use it for the same purpose. You'll get similar effectiveness rates, and that's kind of what we did. And we always knew that if we're going after $1 billion market that has been producing billions of dollars for decades, you need to button up here, right? You need to gather clinical evidence that proves that your product works. You need to be mindful of the regulatory space that governs this field, the medical device field. Even though we're a consumer tech company, we're growing, subscriptions, LTV to CPA ratios. Those are the metrics that we live and breathe. You still have that component of operating in a medical device environment, and that's something that I think we really mastered over the years. And so if you go to the next slide, which I still don't see, but I think it is where I describe the Natural Cycles platform. I would say that this is really what we've been building the last 7 years is a platform, an infrastructure, if you want to call it like this, that allows to host a different set of products addressing different unmet needs in women's health. And that platform is FDA compliant. It's also compliant and CE marked. It's has cybersecurity risk measurements in place. And then we host different types of products. I mentioned the birth control product. We also have a fertility product on it, and it's those are very engaging products. People interact with them 5 days a week on average, and as they interact with them, they feed data through it that feeds into the platform that we can then use to either optimize existing algorithms, develop new algorithms, perform research very capital efficiently. All this while staying in compliance with medical device regulations and adhering to state-of-the-art standards that pertain to medical device and cybersecurity aspects. So I think that's really like the $1 billion platform that we're trying to build. I think there's another avenue that we're also starting to explore. It's the licensing, where we see that we've been approached by large incumbents that have really started to appreciate the work we've done, the validation we've done, the compliance we have achieved with the FDA, and they have different use cases where this could be where they could leverage Natural Cycles. For instance, any therapeutic area where the drug intake is timed with the menstrual cycle it could be of interest, right? So I think this is really what we're trying to do. So as I said, we have a product in birth control, a product in planning and monitoring a pregnancy. The idea is to extend the lifetime, so also of a user by having more products that solve different needs as she goes through her reproductive life stage. So menopause would be next. But I also just want to clarify that women's health, although historically has been confined to reproductive organs, I do see it more as a women's health company. So all health can be diabetes, cardiovascular, can be all sorts of things. Always with the women as the boundary condition as our target customer. Next slide. I think that's a brief summary of what Natural Cycles has done. I think I don't need to spend too much time on it, but we did indeed our flagship product is a contraceptive product. We've managed to build the most effective, non-hormonal, non-invasive birth control option, and it's also used for fertility planning at the moment. We are the first and only app that is both cleared in the US and in Europe. We've also gotten the clearance in Australia and in Singapore, and the idea is to really bring this globally to the market. And most importantly, I think our users love our product. I think the notifications, if you go into the App Store and you read what the users are writing about, this is a convenient app that they love to use. It's fun to use. It's really a game changer for many of the women. They've been struggling to find a solution that suits them, and this is really a missing piece. So Natural Cycles, is not something that is like a trend for the current. It's not just a trend that will go up and go down. This is birth control. This will stay forever. This is a big need globally. And just like the pill is now 60 years old, there's no future where you cannot have where you cannot imagine having Natural Cycles part of that landscape. So the next slide, I think it says prevent pregnancy. This is just to give you an overview of how the product works. A woman measures her temperature in her mouth, types it into the app, and then an algorithm computes the red and the green day, depending on whether there's a risk of pregnancy or not. On a red day, she then has to use protection. I think I'll come back to that later, but I think this is an area also that, can improve further. We have the best product out there, but I think it still could be done better. For instance, the temperature collection could be done via wearable, and we have actually submitted data last year to the FDA and to the Europeans that we can use a wearable as an input into our algorithm, and that could potentially open up to Natural Cycles to be used in conjunction with Apple Watches, Fitbits, all these things, right? And that's something that we're very eager to bring to market, and will be very exciting. And then, even further down the line, but that's more on the biotech side. Alternatives to condoms are in the pipelines, which could make it more to find more options to use on red days, which will be interesting. The next slide is plan and monitor a pregnancy. So if you go to the next slide, it's a separate product that lives on that platform, and there the focus is really on helping women to achieve pregnancy, and most importantly, I think it's to understand why women cannot get pregnant. I think I'm not super interested in just helping I think women that will get pregnant with an app will make it slightly faster perhaps, but 85% of women get pregnant of couples get pregnant within a year anyways, right? So you're not really solving the real problem. Is for those that really cannot get pregnant, and then trying to understand why they cannot get pregnant, and then helping them to connect them to treatment, right? This is where I mentioned that, our product can be complementary to drugs. It doesn't have to necessarily replace it. I think that's where I see a huge opportunity. And I think right now this is only 25% of our business. And actually it's mainly as an extension to the contraceptive lifetime. We build this product to keep them on. But I think that this has huge potential, especially when you go into the healthcare system, because that's where cost savings can be made and efficiencies can be gained in fertility treatments. That's something very exciting. The next slide is just a slide to show that, in the spirit of building clinical evidence to validate our product, this is something that we've, started from the very beginning. We've been publishing studies in peer-reviewed journal with the leading experts in the field. And I think over the time, we have managed to gather a lot of support in the medical community. It wasn't always like that because we were new and it wasn't tried and tested. And there was, maybe one publication out, but now we have more than 10 out there. We have several in the pipelines. We have presented at all the important congresses. And, very important people in the field are accepting that this is an unmet need. Women need something like this. And Natural Cycles has done the hard work that was necessary to gain credibility. if you go to the next slide, I think it's a consequence of that is that, for instance, very like government authorities have started to put us on their websites as one of the options in contraceptive options. Like for instance, the CDC in the US has put us up there, and in the landscape, like natural cycles is not the most effective options. The implant, for instance, that is always inside your body is much more effective. Sterilization for those that already had the kids is also more effective. It's similarly effective to the pill and more effective than condom used alone or so. So, and especially among the non-hormonal options, I think natural cycles really has shown in its evidence that it's very effective at scale. So it can be used by a lot of people without any training or interaction with a doctor and still be effective. The next slide basically also gives a little bit more flavor about what we've done in terms of regulatory. But as I mentioned, we're FDA cleared, we're CE marked, we're rolling out internationally, and we really have mastered building engaging consumer products like Netflix and Spotify, A/B testing us through the funnel and all this, while adhering to the highest standards of medical device manufacturing. We're being audited every year. In fact, I've just jumped out of the audit now, and we'll jump back in later. We've been audited every year, sometimes twice. Sometimes the audits have been audited, and we have really been successful at building credibility with the authorities over time. The next slide is how we acquire customers. And that's, I would say, nothing unique about us. It's a very classic direct-to-consumer digital acquisition. So Facebook, Instagram, influencers, PR, optimizing, A/B testing, the content, the audience, the channels, and constantly like building this out. And I think over the time, you'll see in the metrics we've managed to get more and more users, keeping the cost per acquisition pretty flat. And I think there's, of course, we're also thinking about the future that we need to also diversify. And we have broke through in retail in Sweden, and we're now actually getting our first orders from CVS in the US. So the retail could be a very interesting scalable space to go to, as well as other areas. Then the next slide, it should say KPIs overview. I will leave it there. I think you'll get it later on, but like in very briefly, we have a subscription business model. We have like 80% of our subscriptions are yearly. So they pay like $90 on average upfront. That includes a thermometer. And then it renews every year automatically. We have 170,000 active subscriptions. A third are in the US. And we're looking to grow this 100% year over year. And here you see the curve in the US going up really nicely the last year, like we're really nicely scaling. Important also to stress is that we have pretty healthy unit economics. We're acquiring customers by being profitable on the first transaction. So we're not losing any money on a P&L basis every month on new acquisition. And all the money that we then make from renewals, which is roughly 40%, then pays, it's 100% margin more or less, and it pays off everything else. So we acquire customers for $50. The LTV over 4 years builds up to $150, and we're growing 100% year on year. We're looking to make $20 million this year in ARR, and we've raised $38 million to date, and we're 50 people. 40%, as I said, of this revenue is renewals, and that makes roughly $8 million, which is almost like our OPEX. So this year we'll break even. Then the next slide. Also, without going into details, you can look at it later. You can see how we manage to scale the new users being acquired while keeping the CPAs, that's the lines, pretty much flat. At the same time, we've always been working on the product, optimizing it, and managed to reduce churn over time. The consequence is an accelerated growth. And it's very exciting to just continue to draw the lines into the future and build a highly profitable business around digital contraception. So if you go to the next slide, I would say like the things that we want to do now is to basically stay focused on growth, especially in the digital contraception side, and continue to grow in the US. We're also big in Sweden and the UK. We also have filed the data for wearable contraception, which is something we want to bring to market. And we're doing this as a dual track of partnerships, but also our own hardware. And all that stuff is available with available funding. As I said, we're not burning anything at the moment, really, and we'll be profitable next year. And we still have funding left to do this. but I am planning to raise a round pretty soon in order to invest in additional growth and building out certain aspects. And those can be categorized on one hand on product and the other hand on channel, like increasing channel. So I think this whole licensing business seems to be interesting and would allow us to scale faster and also grow revenues. I think the developing B2B2C is important as we start scaling on the consumer side to find new channels to stay efficient, to be able to continue to grow. And that can be retail, but that can also be employers in the US and health insurance plans that I mentioned, right? This is super interesting. We can use the same product, but get it covered instead by insurances. And on the product side, I think what I'd like to raise money for most specifically would be to develop a product on menopause to really continue that lifetime and start having that in the pipeline as we build new algorithms and solve problems in menopause. So that would be why we would raise money. So on one hand, we have an existing business. It's going to grow fine. It's a very large market, and we have all the funds we need to do what we need to do. Then I want to invest in certain areas we haven't developed yet so far that will require people, know-how, and some execution, and which is developing the B2B2C, the non-direct to consumer part of the business, and then developing the product. I think that's it from my side. I'm happy to take questions.
So, thank you very much, Raul. Very interesting story and journey, of course. If we could just get back to the beginning in 2013 when you co-founded the company, what was the reason behind creating the company, and how has your role changed since then?
Yeah, interestingly, it hasn't changed a lot, but I tell you, so we are, a wife-husband team. My wife is Swedish. That makes the Swedish connection a little bit too. But we started in Switzerland. Anyways, that doesn't matter. And so she came from the angle that, she wanted something that is hormone-free yet effective. She was on hormone contraception for 10 years, and now she felt like taking a break. She wanted to have children. We wanted to have children in a couple of years. And so then when we looked into it, there was a missing piece, right? And so she really came at it from a personal need, and she represents really like a massive trend of people starting to become conscious, especially after when they approach the 30s, to think about is it right to put hormones in every day? Maybe now that I want to have children in a couple of years, I want to skip. And so that's just a massive trend that is happening, right? Like you're thinking about what food you eat. And then, obviously being healthy and medicating you every day, of course, comes with the benefit of not getting pregnant, but, there's a need for alternatives. I came from it from a different angle. So my whole research actually revolved around energy and trying to use sensors and transistors that are more energy efficient. And so I was always interested in actually climate change related type of topics, and digital contraception for me was something that I found interesting because because that's really the other side of the equation, right? It's the number of the people on the planet, and I think I think this is an extremely important part to solve and to bring to the market, because there's also other regions in the world that do not want to use hormone contraception for all sorts of reasons, and so I think we would be able to have a product that could also make a real big impact there. So we came up from it from different angles, but that's kind of still what we like to do, and I think we in general, I think what we really like to do is to innovate, not just take existing technology, put it together and then sell it, but really create that technology and then sell it. Yeah.
Okay. And when you created this company, digital contraception was a non-existing market, and considering that you were the first FDA-approved digital contraceptive, what were the biggest challenges to create this new market?
I have a lot of battle wounds and from the last 7 years of what we had to go through and endure. First of all, I have a fun story to tell that in Sweden, we called all the preventivmedels are called p-something, p-pill, p-ring, p-stav. And so when we started, we called it p-up. But at that time, there was a parkeringsapp in Stockholm that was also called p-up. But over time now, we became so big that now they call themselves Vitala P, and we're just the pay up, which is pretty cool. I take this as a sign of victory. But jokes aside, I think the biggest challenge was not the parkeringsapp competition. It was it was the fact that, you know, like in some ways it's extremely radical what we're doing, because we are typically you develop a drug and then you get a doctor to prescribe it to a customer, and now we're circumventing, short-circuiting this whole value chain. No doctor involved, no pharmaceutical involved, straight to the consumer, and she takes her decision. And I think that's quite disruptive. I think it's great because the healthcare system everywhere, the US especially, but you know, even in Sweden, you can argue that everywhere the healthcare system puts a lot of strain on society. And I think alleviating for things like contraception, where you know most of the products are available and the consumer can make their own choices, get them over the counter. I think that's a classic example of, you know, like where the future should go to. Surgeries will for a very long time not be able to be done at home, right? We will need to go see a doctor, but for contraception, that's something that obviously telemedicine and then like should be fairly available over the counter as well, in my opinion. And so that came with a lot of criticism, right? Because you go directly to the customer, the doctor suddenly like they only a few people know about us, and then the vast majority didn't. So then they were scared, right? Is this a proper product? And then so like on one hand, what really needed to be done is publish the studies, get the regulatory bodies on our side, because they ultimately decide whether something is safe or not for society, not the doctors. But then over time, you know, then it takes time to just gain acceptance among the medical community, and that's really time consuming and expensive. Something that tech investors have very little patience for, or at least not used to, right? Like they say, like why does it cost so much? You know, like, and there's no return of investment and so on. But I think it's something that, you know, like even in the next round, I would set aside a certain budget to just invest in that space, because it builds defensibility over time. And I would say that's, you know, like that's been the biggest challenge, and it will continue to require investment into that area over time. But thankfully, you know, it's all about being tried and tested and credible. And the longer we're on the market, the more publications we have, and the more acceptance we'll gain, and then we'll be ingrained. And then it's also harder for competition to come in and reproduce that, because it's, you know, they will have to compare them to the gold standard, which is us.
Yeah, convenience and trust. Convenience and
Yeah.
trust. Okay, has your business been affected by the Corona crisis?
Yeah, I would say like mildly positive. So I think, you know, like we're in digital health. Digital health as a whole category gotten a boost. I'm not talking telemedicine or Grubhub, food delivery type of boost, but you know, like our, you know, women wanted to delay pregnancies more during that time. So we saw that more people used our product for preventing pregnancy than planning pregnancy. For a while, it was you know, like recommended to take your temperature every morning. So we were like spot on with our product, and we could really see that also in our retention rates. But I would say overall, like, you know, it has given us a growth boost, but not something that was like you know, a game changer, right? We've been growing also before that, and it's been continuing over the course of it. I think the company has adapted operationally wise really well. We're all remote, and actually that the efficiency working across time zones with different offices has actually increased. And we're actually quite excited to continue on that path also moving forward post-pandemic. So I think overall we've not been we're blessed to not have been negatively impacted by it. That's how I would put it.
I see. Okay, and to round things up, you have touched upon this a couple of times in your presentation, but if you were to paint us a picture of what Natural Cycles will look like, let's say 3 years forward, what would that look like?
Yeah, well, I think we would have we would be on, like, the wearable contraception concept will have hit the market and really started materializing and accelerate our growth rates. I think we'll be in most major markets. Also, the European expansion is something that we think is very interesting, but also Brazil, India, China, Asia in general, I think it's big, right? So like we would have progressed a lot on that front. And I think we would have also extended our platform with a product also in menopause, which is a phenomenally big market, underserved, and I think using the same approach again, like really to create new technology that solves, the hot flashes, the annoying side effects that you go through, and help them connect that with treatment. That's something that I think you'll see from 3 years onwards. I often look even a little bit long into the future, and then I do think that we can really build a large, like digital pharmaceutical in some ways that produces, digital solutions just like pills to address all sorts of therapeutic areas in women's health. And we have to stay so focused now over the next, every quarter we have to stay focused. But I think long term, there's a lot of efficiency that will be able to be gained in the healthcare system from going straight to consumer and digital solutions. And I think there's a couple of companies with that same approach, and I think this is a very exciting field to be working in.
Okay, thank you very much once again, and good luck on your journey.
Thank you for the organization.
Thanks.
Bye.
Bye. So we'll take a short break and be back soon. Now have with us the company Doctrin and CEO Anna-Karin Edstedt-Bonamy. Welcome.
Thank you so much. And thanks for inviting us to participate in this event. I am going to present how we at Doctrin radically improves healthcare by enabling physical healthcare using our digital solutions. I have myself a long background in Swedish healthcare, having worked as a medical doctor, specialist in pediatrics, and associate professor at the Karolinska Institute for almost 20 years before joining Doctrin 4 years ago, and now in the role as CEO since 1 year. If we move to the next slide, please. It's no surprise to you after this day that healthcare faces severe challenges with increasing costs, low productivity, substandard accessibility, and really poor satisfaction, and that healthcare is still dominated by manual processes, both in Sweden and elsewhere. Next slide, please. What we do is that we provide good, modern digital tools to, in Sweden, as an example, the 63 million regular healthcare consultations that take place in primary care and specialist outpatient care every year. We tend to talk a lot about the telemedicine providers in Sweden and other countries, but they actually only provide a very minor proportion of all the healthcare that is taking place out there. We sell our solution business to business as a software as a service, where our business model reflects the reimbursement model that the healthcare provider has. And this means, for example, in primary care, that the healthcare provider pays us per listed patient per month in capitated models like in Sweden and the UK, for example. We have made sure to develop our product in such a way that it's globally scalable. And we have made sure to address and digitalize and automate the parts of the patient journey that are similar across healthcare systems, while diagnosis suggestions and treatment recommendations that vary enormously, even within a country, are not part of our standard product offering. The fact that we build on the existing healthcare system and their existing resources makes our way of working a bit less challenging to regulatory systems as compared to the telemedicine providers. If we move to the next slide. I just want to stress that the main differentiator between our digital consultation platform and many of the other digital consultation platforms on the market is that we have a very broad but also deep medical content. So we make sure to address the information needs in every type of patient journey that can exist in specialist outpatient care and primary care, whether it's the patient's first visit for a symptom, or if it's a chronically ill patient, or a follow-up for a yearly checkup, for example. We have chat as the primary communication mode in the platform, but also provide increasingly advanced video solutions, both for individual patient care provider interactions, but also for multiple care providers having a video call with the same patient, etc. We integrate to other systems, of course, and make sure to address like the business critical integration needs of our customers. And we work a lot with expanding our business intelligence offering, because we realize that healthcare will be radically better if healthcare providers use the data and the insights that we can actually give them about how they could improve their activities, both for their own sake, but most importantly for the patients. If we move to the next slide, I just want to give you a very brief overview. Some of you might be familiar with how such a platform works, but for those of you who are not, I just want to explain without going into too much detail how it actually works. Either a patient seeks care, and it could be for just any reason that this patient has to contact their healthcare provider, which could be a primary care center, but it could also be a specialist outpatient clinic. So either the patient contacts the clinic or healthcare reaches out to patients. And this is an unmet need, I would say, because we observed that since we launched this feature a couple of years ago, about 25% of all patient cases in our platform is actually about healthcare needing to contact the patient, about test results, follow-up questions, filling in a questionnaire before a planned consultation, etc. All patients fill in some sort of medical form. It may be a very short one with just a couple of questions, or there might be 25 questions for a more advanced consultation. The result of the questionnaire is summarized in a structured medical history report that can also be used as a basis for sorting the patient to both the right profession, but quite soon also to the right type of unit. So if you have the enterprise solution, you can actually optimize the patient flows within your enterprise solution automatically. Any type of patient-clinician communication is possible, video chat, or some doctors sometimes even phone the patients using the information we have provided as basis for that phone call. You can also collaborate in the platform, and this is one of the best features, I would say, from my professional point of view, because you can have multiple professions gathering around the same patient case, but you can also seamlessly transfer patient cases from one profession to another, both within a unit, but also, more importantly, between units in a safe way where patient gives consent to data handling, etc., along the way. And it's very nice. If we move on to the next slide, Doctrin has been on the market for a bit more than 4 years. We grew quite slowly in the beginning, but are now really ready to take off. We have 25 customers today, all live mostly in Sweden, but also in Norway and the Czech Republic. And we will launch on the UK market with our first customer in the end of June this year. It's publicly financed private healthcare provider, primary healthcare provider, which is a quite large organization. So we are like really ready to scale and to move on to new markets. If we look on the next slide, what has been key to us on our journey over the last 4 years in Sweden, where we have grown really big, first in primary care, but now also are growing quite rapidly in specialist care, is that we bring value to our customers by combining improved medical quality with increased efficiency and improved both patient and healthcare provider satisfaction. We are not like ready to have only 2 out of those 3. So if we move to the next slide, so I will show you some results from our impact model. This is from a very large healthcare center in the center of Stockholm that we have followed over the last 2 years since they implemented our solution in the end of 2018, where they had enormous problems with same-day accessibility to the health center. people just couldn't reach their healthcare provider the same day. So 1 out of 4 patients didn't get in touch. It immediately improved after providing the center with a digital entry. 95% of patients got an answer from their healthcare provider the same day, and these results have continued to improve as more patients get used to using the solution. Another important measure of medical quality is continuity of care. That means that you meet the same doctor as often as possible. And this is important both because it's more efficient to meet the same patient. It's quicker. The patient is usually more satisfied to see someone they know, and it's medically important because you detect warning signs if you see the same patient rather than like seeing different patients all the time. And before Doctrin, the continuity in this health center was 49%, but thanks to all health professionals really working in the platform on a daily basis, the continuity is now, after 2 years of implementation, up to 73%, which is amazing figures. So that was about medical quality. If we look at efficiency, it's equally interesting. On the next slide, please. What we have also seen is that although we only digitalized 30% of the incoming contacts, this means that 30% converted from phoning the health center to using the digital platform, we could, over the first year of implementation, see a 33% productivity increase as a whole in the health center, meaning that each clinician saw 33% more patients per worked hour. And this is largely due to the chat-based way of working, which is much more efficient, but they also had fewer late cancellations, for example, because in the digiphysical way of working, when you know that you first meet your doctor online and then you meet the same doctor in the afternoon, the likelihood of dropping off is obviously much lower than in a pre-booked setting. We also know that we didn't increase like the burden overall for the health center because as the number of digital contacts increased, the patient phone calls dropped, and this is really a work environment relief to the staff. We could also see that the number of frequent attenders, people that either are really ill, but often have also health anxiety, so they seek care more often than needed for their physical health, dropped by almost 40%. And this has a huge potential of cost savings because this is a very, very expensive group of patients in healthcare. And we think that this is due to the improved continuity, that patients who are worried about their health actually get to see their own doctor more often. If we look at the next slide, the employee satisfaction, I see the contrast is not perfect here, but this slide tells you that since this large health center, Ringen, implemented the Doctrin system, the sick leave has actually decreased a bit, even during the pandemic, and this is largely due to the fact that healthcare staff has, for the first time in their professional lives, been able to work from home in a secure and safe way, so they can use their competence even if they have a minor cold, for example. What is even more impressive is that this health center, as many other health centers in the region that we compare these data against, had a huge problem with staff turnover before implementation. It was 17% when we started, and then it actually went up a bit in the beginning. And now the dark green line, it is down to only 7% from an all-time high of just above 20%. And they also find it much easier to recruit. And they say it's because healthcare staff like mixing digital and physical ways of working, but also because they have a much better work environment with lower ethical stress where they can actually meet the patient's needs on an everyday basis. If we look at the next slide, these data I just showed you are only from one health center, but we have grown to become one or the largest digital consultation platform in Sweden. In 2020, the number of monthly patient cases increased by almost 300%, up to just above 100,000 per month by the end of the year 2020. And this means like human interactions, real clinicians, nurses and doctors taking care of real patients 100,000 times per month. And to give you like the latest data, we have increased by 40% since the end of the year. So we are now up to 140,000 consultations per month in the platform and steadily increasing with more usage and also more customers joining. We have now to date implemented our solution at a bit more than 200 healthcare units in Sweden, Norway and the Czech Republic, and soon going live in the UK. And this also saw a big increase in 2020. If we look at the next slide, I just want to highlight that we have really proven that to be extremely successful in the primary care vertical, which is the vertical we started to build our expertise within a few years back. And we today have 50% of the Swedish private primary care market. The Swedish primary care market, the private one, lists 4 million patients. That's 40% of the population. And we deliver our digital platform to almost 2 million of these patients with only the top 3 providers we have, Capio, Praktikertjänst and Lideta, all having full contracts for both their primary care, but also now from 2020, their specialist care activities. So what we are doing currently is to take our scalable primary care concept and now move that to and adapting that to the specialist care vertical, which is also a very, very big vertical where we will be growing a lot over the coming 2 years. If we look on the next slide, just to summarize, we have 3 axes along which we will grow. Our focus has been and still is very much in primary care, both in Sweden, in the other markets, and that's also the area where we see the biggest growth entering the UK market. We are learning to do each and every specialist vertical in a very structured way to make it a scalable business. And we have come quite far with the biggest medical specialties like orthopedics, gynecology, pediatrics, just to mention a few. But we also see that our solution can be used in many types of healthcare segments we haven't even addressed yet, like elderly care. We actually have a minor activity in dental care, and we see that there is a big growth potential in that area as well. When it comes to geographies, much focus is still on the Nordics, especially for developing scalable concepts that we then can adapt into new markets like we do with the Swedish primary care concept when we bring it to the UK, which is a big market quite similar to Sweden. We also see other countries as very interesting, like the Netherlands, Spain and Portugal, just to mention a few where we think we have a great product market fit. When it comes to product development, a lot of focus has been on the healthcare platform and making that both scalable, but also addressing all the needs that patients and healthcare providers have. We are not done with that work, but we have done most of the 3-year plan we had to have a very complete product. Now we are working on expanding our offering with different add-ons, data add-ons, for example, to focus more on business intelligence, but also to gather a lot of high qualitative structured data to use for our AI-driven product development that we have in our on our roadmap. If we look just briefly on the business plan for the coming years, I think on the next slide. We have a business plan projecting to grow 60 to 70% in annual growth rate for several years to come. And we have quite solid data and a solid pipeline that show to us that this is not overly optimistic. It is possible. We will see improving gross margins over time, up to above 90%. And also the EBITDA margin will improve over time, and we will reach break even by the end of 2023, 2024, according to the current business plan. We are quite confident. If we look at our projected revenue for this year, more than 2/3 is contracted with our current customers. And if we look at next year, it's more than 40% that is already contracted of the 85 million Swedish crowns that we have in the 2022 business plan, just to give an example. And we have a very, very solid pipeline, and we have a very good conversion rate of the deals in our pipeline, since we are the trusted vendor to the private care market in Sweden, and many other market takes Sweden as an example. So to end, I think there might be a summary slide also, if we look at the next slide. I really would be happy to take questions, and also please contact me if you would like to learn more about Doktor.se, our product, and our past and future journey. Thank you very much.
Thank you very much, Anna-Karin, for a very interesting presentation and a very impressive development of the company. 2020 was a special year, obviously, and this, I suppose, posed challenges to you, perhaps in some ways handling the growth, or in some ways handling other problems. Could you elaborate a bit on that, please?
Oh, we all learned a lot in 2020. I would say, like, the positive things with 2020 was that our current already contracted customers became extremely motivated to do a broad and fast rollout, which was good for everyone, the patients, for us, for them. We learned how to do implementation digitally, which has been very good for us, because that allows us to increase our margins and address smaller customers that we could afford to do before. So we have actually expanded our activities into to actually address the private SME segment, which we didn't do before. And that's thanks to the pandemic and the digital implementation that is possible for us. What has been challenging is that to make the most and best use of our product, it's not only about the platform, it's about change management. It's about being willing as a healthcare provider to take on some sort of transformation project, at least if you would like to achieve those good results that I showed you from the Capio case with those big increases in efficiency, etc. We found it extremely challenging to find healthcare providers that were prepared to take on a big change project during a pandemic. But luckily, that was actually, in hindsight, quite a brief pause, I would say, in our sales, the sales cycles became much longer than they usually are. And now, when the pandemic situation is more like the everyday situation, customers are really coming back and saying that we can't get more out of our video platform. We know that you are doing something very differently with a stronger medical focus, with very nice evidence. Could you please come and help us? So we have actually taken over quite a few customers from other digital platforms because of that lately. We have never lost a customer. We are extremely proud of that. I really hope to keep that zero churn that we've had for the past 5 years now. And I think that it is because the product becomes extremely sticky, because it's really the centerpiece of the everyday working life for the healthcare professional.
I see. Interesting insights. So, looking purely at the growth last year, which were the biggest contributors to your success? I guess it was your current customers rather than new customers, because of the prolonged sales cycles. Should we leave it at that, or would you like to add something more to that?
No, I just want to stress how important customers are to us, and also the upselling we did with them last year that they, after having worked with us for a couple of years, both decided to expand their agreements with us in such a way that we also could include their specialist activities. We are very proud of that, and that also gives us a safe ground to build that concept, that scalable specialist care concept, together with our very knowledgeable large customers.
And looking at Doctrin Network, a service for more seamless patient journey and cooperation between departments, could you elaborate a bit regarding this product and its potential?
Doctrin Network is an add-on module to our existing product where healthcare providers that use it seamlessly can help patients in the patient journey from one care level to another, from one profession to another, in a safe way, where we actually keep the database integrity, but we make the user interface totally seamless for the patient. So they have the impression to only repeat information once, to stay in the same consultation room, so the primary care physician can see them first, then the primary care physician hands over the case to their specialist physician, who joins the same room, no repeating of information, everything is secure, transparent to the patient, and all information needed is available to the clinician, and it's compliant with all regulations. This has enormous potential for our customers because it means that they can keep referrals within their own organizations. And since there are different reimbursement systems for primary care and specialist care, it's very important that their primary care referrals don't go somewhere else, because then someone else will get that money for a consultation they could have done themselves within their own organization.
Pretty strong selling point, I would say.
Yeah, and also good for attracting patients, because it's also a battle ongoing out there about listing patients, and to provide seamless patient journeys is, of course, a very strong marketing point as well.
And the international rollout, what does the competition look like out there? And are the other countries, have they come as far or longer, perhaps further than Sweden?
It varies by country. I would say that the UK market that we are entering now is one of the most mature in the world, probably. They have very good national regulations, very clear processes for how we can act as digital platform providers, also very good framework agreements, which facilitate sales processes enormously. So congratulations, UK. For us, it's quite good to enter a mature market, because then we don't have to fight against that initial resistance that we quite often see among professional users of the product. I mean, it's hard to change, but if you already have a platform and you're changing for a more one with a better user experience, better efficiency, nicer working environment, then that change will be easier. So we hope to grow quite quickly in the UK.
I see. And what about competition then?
Competition is, of course, advanced, and they are having lots and lots of resources, but it's also a big market. And I think that, like, the market as a whole and healthcare as a whole will benefit from this competition. We make each other better. So I welcome the competition on the UK market.
All right. You recently, or during 2020, closed a financing round. Do you have any plans for a future IPO?
When we are ready for that, we can definitely see that it is something that we could aim for as a company. But that will be a question also for the board and the owners, of course. But we have not said that we are not going to do an IPO. We could definitely be ready for that in a few years, perhaps.
Okay. And perhaps a bit odd question. Looking at the list of speakers, presenters today, half of the CEOs presenting have actually been women. And we recently also hosted a Nordic Swiss biotech conference where also many of the investment managers covering the sector and the research analysts were actually women as well. Is that a coincidence, or is this a ground for women to kind of be at least equal, if not more represented?
I truly think that we need more women in tech in general to make solutions that are better for everyone. So it's really, really happy news that you are bringing me here. I quite often feel quite lonely as a woman, and I also have a different background, being a pediatrician by training, which is perhaps quite uncommon for a tech CEO. But I think that healthcare it's about human beings, and I think that might perhaps more easily attract women.
Good. It's a positive development anyway. And finally, if you could give us an idea of what Doctrin will look 3 years down the line.
3 years down the line, we will be on several European markets, apart from those that we are already on, and the UK. We will be the centerpiece of the clinical staff's working day for the clinical staff that work in outpatient care, either specialist, primary, or perhaps dental. We will have proven that our results from Sweden are reproducible on each and every market we enter, but we might have to adjust our impact model to make sure to measure the problems that exist in the current market, so that we make sure to radically improve healthcare for as many patients as possible, keeping the staff's working environment in mind and the healthcare providers' financial results also in focus.
Yes, because I noticed that in your presentation that you have a lot of numbers showing really clearly the benefits of your platform, and that's something that I think appeals to basically everyone that is looking to either invest or work with you. So thank you very much once again for a superb presentation, and good luck on your journey.
Thank you so much for having me on Doctrin, and I'm happy to be contacted if anyone has questions. Thank you.
Thank you. Bye.
Bye.
So just a brief recess before we go into the final stage. Hello and welcome back. With me I have now Christian Hellman, CEO of Edastra. Welcome, Christian.
Thank you. Nice to be here.
Great. So for starters, could you tell us a bit about yourself and Edastra?
Of course. Edastra is a private investment company founded by entrepreneur and investor Robert Aldin. He founded the business close to 15 years ago, so it's been around for a while. I joined the firm last year as CEO and investment manager. Before that, I was an analyst, equity analyst for many years at various banks here in Stockholm. And we're basically taking the firm to the next level and putting us on the map basically as a long-term owner of growing businesses.
Exciting. Must be a really interesting job.
Very much.
I can imagine. And so when you look at different investments, how do you sift through them?
Yeah, that's a good question. There's a lot of potential investments around. We invest both in listed and unlisted companies, so obviously the playing field is enormous. We focus on Stockholm and Sweden, but still there's a lot of investments. We're fundamental investors, so obviously we look at the fundamentals to start with. We're long term, so that's also very important for us to see where the company can be in maybe 3 to 5 years. Not so much what happens over the next quarter. But I would say fundamentals very important. Especially when we look at the more mature companies. When we look at more startup-based companies, it's obviously a lot focus on the entrepreneur and the team and the track record, the actual people. But it's a combination.
Yeah. And do you get approached by a lot of companies, or do you have a systematic process that you repeat every week, or?
It's a combination. We do get approached by a lot of companies, also indirectly through various banks and investment banks. But we also try to be proactive and and find companies ourselves. But that also requires a lot of effort and time. I wouldn't say it's systematic in a sense that we repeat the process every week, but we try to be very open-minded and have our eyes open. And when we come across something that sounds interesting, we definitely approach that business or the owners of that business and try to be first on the ball.
And given Robert's background, your background, is it purely tech companies, or do you invest in more like, would you buy Skanska, for instance, or would you buy?
Perhaps not Skanska or other construction companies, but it's not solely tech. We do try to favor cases that benefit from digitalization as well as sustainability. That's perhaps our two main investment themes. So in that sense, e-health companies are very much of interest for us. But we try to be relatively broad, so it doesn't have to be pure SaaS companies or other super techy businesses. But obviously, it's nice if they. The foundation is that we want to try to find businesses that have the ability to scale. And grow earnings at a high rate, and you find those businesses often in the tech sector. So I would say that that's perhaps how we look at it. It doesn't have to be tech, but obviously, if you look for scalable businesses that can grow fast, grow earnings quickly, then you sort of you get into the tech sector by default, in a sense.
Yeah, I see. And what do you see as the most important drivers behind digitalization?
Obviously technology has enabled this, but at the end of the day, I think it comes down to the fact that consumers can benefit from it, and companies they can also benefit from this new technology, whether it's the mobile phone or whatever. It enables businesses to perhaps either save cost or perhaps attract new clients, new consumers by reaching out globally. So at the end of the day, it's about the P&L, and it enables businesses to grow faster, and for consumers, it's all usually a convenience factor. So I guess those are the perhaps underlying driving forces why digital companies benefit, and that's also at the end of the day why it's quite interesting for us to focus on those types of businesses.
Yes, I believe convenience is a really important factor. Like you said, it should be easy for the consumer, cost efficient, and also trust is another, of course, crucial factor in any industry. And I believe that's what has been really driving the growth also in 2020, when people were basically forced to trust these digital solutions, these remote services, and that, of course, propelled the development. What should have taken or would have normally taken 2, 3, 4 years was now done in 1 year.
I agree.
So it was in that sense, it was really exciting to watch the pandemic, not considering all the negative effects, of course. So do you think the healthcare sector, being traditional, conventional, perhaps even conservative, has it been more difficult than other sectors to digitalize and to continue to drive digitalization in?
I think so. I agree with you in that sense. I mean, there's also a lot of regulations within the healthcare space. It's a large chunk of it is in the public sector. Obviously, there's some private parts of it but the vast majority of healthcare does take place within the public space, and with that comes regulation and politics and other factors to consider, which usually tend to slow things up a bit. So in that sense, yes, I would say that it takes more time. But on the other hand, once it sort of starts to develop and evolve, I would say it's fairly sticky as well. So long term, I think it's beneficial, but yes, it takes longer for obvious reasons.
Interesting. Yeah, the late Stenbeck used to say that technology will always in the end trump politics.
Exactly.
So it will just take some time.
Takes a bit longer, but it sure will.
Yeah. Okay, so let's look at the flip side of the coin. Any pitfalls in digitalization, and from an investor's perspective, also risk that come with that? Just generally speaking.
Generally speaking, well, in a sense, obviously it enables high growth and convenience, but I also think that the switching costs, perhaps, from a consumer point of view, also becomes much lower. You have everything at the palm of your hand, so it becomes very easy for the consumer to change supplier or change services. So it really it's crucial for companies to be on their tiptoes and really stay at the forefront all the time, because it's very easy for the consumer to just change product when everything is so convenient as it is. So that's something that we look out for quite a lot.
I see. Interesting, valid point, I think. What trends and investment opportunities have you seen in digital health as a consequence of the pandemic?
Well, one quite tangible is testing companies. Seen quite a few of those pop up, where obviously you can test for COVID, but also for other infections and diseases, and I think that's quite interesting. I think perhaps that the caregiver or the consumer has become more aware of testing and of staying healthy in a sense. So we've seen quite a lot of those companies pop up, and I think also structurally that's here to stay. You will test yourself more frequently.
Yeah.
Perhaps for virus infections, but also for other diseases. So I think that's quite an interesting opportunity.
Okay. Which parts of the digitalization of healthcare do you see as most interesting from an investment perspective, and why?
Well, I think these electronic care givers such as Kry and Doktor.se here in Sweden, I think they are very interesting, because it's a win-win situation for at least most parties concerned. Obviously, there's some debate about them from a political point of view, but I do think that, as you said, with to quote Jan Stenbeck, that the technology wins in the end, and the consumer benefits greatly from being able to access a doctor by his or her phone, and at the same time from a public point of view, it is a cost saver in the end, no matter how you look at it. So I think at the end it will be considered a true win-win, and it will be here to stay, even though there are some articles and debate about it in the media. But I do think that when you have that type of win-win situation, it will be a structural shift, and and that's obviously quite interesting. So yeah, those types of companies are very interesting to me because that's something that will create value over a long term.
Yeah, I mean, it's the research I did before this event was, filled with the buzzwords and, pretty abstract things from Gartner and other research firms. But looking at the presentations of the companies today, the benefits they create are quite tangible. We've already been talking about convenience, accessibility. There's the patient-centric model now that really integrates all the caregivers around the patient and not the other way around, where the patient would have to, visit 3 or 4 or 5 different institutions to get perhaps a diagnosis, to get rehab help, to go to a specialist, etc., etc.
Exactly.
So this is very comforting, and it feels like it's really, like you said, a win-win for everyone. Other things I picked up today, a new word, digiphysical.
All right.
The combination of digital,
yes,
where the access point of patients seems to always be digital. I mean, at least it's the best access point. And then, to whatever extent possible, the care should be delivered digital because it's the most effective way. But of course, some care cannot be digital. It has to be physical, hence the digiphysical expression.
I understand.
That really stuck to me. And we've talked about trust. We've talked about several of the companies here today mentioned longer sales cycles, and that was also something that was a recurring comment from the software as a service companies we had an event with a month back. Also, the business scaling, but longer sales cycles.
Because of the pandemic, or in...
Yeah, exactly, because of the pandemic. We're talking 2020, last year. And also the companies today also said that they were able to grow their business with their current clients a lot. So, increased usage and more services to the same clients. So that was also interesting. And that also shows that we're probably just, really early days. Even though we've seen this immense growth, it's early days. 2 out of 10 patients had tried e-health in Sweden, so that's a pretty low number. I mean, in a few years' time, we'll be, looking at numbers like, I don't know, quadruple that, or, 80, 90.
Surely.
Close to 100% in the foreseeable future, my own belief.
Yeah, I agree with you, and that's quite interesting because even though that's low numbers, we are early adopters in Sweden in general when it comes to tech innovations, and obviously that will help spur the growth of these Swedish e-health tech companies, and hopefully that could also help them grow abroad and perhaps gain the upper hand of some international competitors. Because the early adoption of Swedish patients helped them gain a good market position globally.
Exactly.
Hopefully.
Yeah. And they are prioritizing growth over profitability, which is absolutely right. Strike while the iron is hot. So I will provide you with contact details to the companies today.
Sounds good.
Several of them said they are actively looking for capital. To conclude, what type of business models would you look for if you want to invest in this trend, and what business models would you kind of be more aware of?
I mean, as I said in the beginning, what we look for is scalability. When it comes to unlisted companies, private companies, obviously they are also generally earlier in their life cycle as a business. So obviously it comes down to a lot of other factors as well, funding, the team, the entrepreneurs. But in terms of business models, it comes back to scalability. And in particular, in terms of e-health and these types of companies, it's political risk is obviously a factor, regulation, because we are in a public sector. So although it's perhaps difficult to find in very small companies, generally I would also like to see that they perhaps not depend on a single country or a single municipality, that they are perhaps a bit diversified geographically, so that they sort of dilute the political risk at least partly. That doesn't come down to perhaps the business model, but I still think it's a quite important factor to consider in this space.
Definitely. So I just came up with another question before we conclude.
Sure.
Would you agree that there are companies that are listed today in the stock market here in Stockholm that do not kind of present themselves as digital health, e-health companies, but who would actually earn that stamp if you kind of, if you looked a bit closer on them?
Perhaps. Feels like you're thinking of a few companies.
I am.
Maybe. You're putting me on the spot here, but
yeah, I'm not asking you to mention any.
No.
It was a trick question, kind of. But basically, that would be my message to convey to perhaps the viewers that there are companies, perhaps in diagnostics, perhaps in other spaces, that use digital information technology, basically, to offer their services or to make their product. Yeah,
I'm sure there are. I mean, all businesses nowadays use technology and or are digital in one way or another. It's just about sort of presenting it and letting investors know what they use. I mean, perhaps some businesses, many have been listed for a number of years, perhaps don't really see themselves as perhaps investors would do. So, yeah,
exactly.
Something up to the IR departments to to get their hands on.
Yeah, very, very good point. So they can, take, get a push from investors by, telling them that they belong to this fast-growing, hopefully successful. Well, I would say basically proven successful space, because the growth numbers we've seen here today from some of the companies are just astonishing. I don't know what to compare them to, because it's seldom that you see this jump in demand generating these revenues so quickly.
That's fantastic to see. Very encouraging.
Very encouraging. And on that happy note, thank you very much, Christian, for coming.
Thank you for asking.
And good luck on your journey as an investor.
Thank you.
So, thank you very much for watching. And if you have any questions, don't hesitate to contact Vator Securities. Have a nice day.